Good morning. I'm Ward 1 Councilmember Brianne Nadeau, the Chair of the Committee on Human Services. Today is Thursday, November 3rd, 2022, and we are holding this hearing using the Zoom online platform. The time is 10 a.m. We are conducting this virtual public oversight hearing to receive testimony regarding the Department of Human Services implementation of historic housing investments. Last year, the Council passed the Homes and Hearts Amendment Act of 2021 as a subtitle in the fiscal year 2022 Budget Support Act of 2021. The amendment imposed a modest increase on the marginal tax rate of the district's wealthiest residents and allocated the revenue from this tax into areas of critical need, including transformational investments in housing. The subtitle and the corresponding Local Budget Act amendment made an unprecedented $65 million investment in new housing vouchers that will allow more than 2,400 residents experiencing homelessness or living in unstable housing to have a safe, stable place to call home. We knew that it would be a challenge to end homelessness for 2,400 households. We knew that it would take several years, but we also know that housing ends homelessness and that the number of people living outside could not deter us from confronting this challenge head-on. The public oversight hearing serves as a forum for the committee and the public to receive a status update from the Department of Human Services, the DC Housing Authority, and the public on the district's progress in implementing these newly available housing investments. It's an opportunity to ensure that historic investments are accompanied by an historic commitment to seeing through the hard work of getting people housed. I want to turn to some logistics for today's hearing. In addition to Zoom, the hearing is being broadcast live on my website at brianneknadeau.com/live and on YouTube. Witnesses who anticipate offering testimony today should know several things about the Zoom platform. All witnesses participating in this webinar are currently listed as attendees in Zoom, which means you can't access your microphone or video at this time. But when it is time for you to join a panel, I'll call your name and we will promote you to the panel. You'll receive an invitation and you have to accept it on your screen. And then when it is your turn, you can unmute yourself and turn on your camera. Representative of organizations today will be allowed 5 minutes to testify, and public witnesses representing themselves will be allowed a total of 3 minutes. We will be calling a single panel of witnesses, and council members will have up to 10 minutes to ask questions of each panel. In order to enhance accessibility, this hearing will have the closed caption function enabled. And if you'd like to turn on this function, please click on the closed caption logo located on the bottom right of your Zoom. For any technical difficulties, send a message to our host labeled as Committee on Human Services. And if you're having trouble gaining access to the Zoom and you've pre-registered, you can reach my team at 202-834-8091 and they will try to resolve your issue. Okay. We have now been joined by at-large Councilmember Robert White, and I will recognize him for an opening statement.
Thank you and good morning, Chairperson Nadeau. I want to thank you and your team for holding this hearing today. And I want to thank the public and government witnesses who are here to testify. In the summer of 2021, Council passed the Homes and Hearts Amendment Act of 2021. Through this legislation, Council invested $65 million into housing vouchers and subsidies for more than 2,400 people experiencing homelessness or housing instability. The goal of this funding is to address the housing crisis in DC and to open housing opportunities to people staying on the street, doubled up in shelters, and the more than 36,000 households remaining on DCHA's voucher waiting list. Almost a year ago today, the Committee on Human Services held its first hearing on the Department of Human Services implementation of those housing investments. DHS lauded the opportunity to make truly transformational change as a result of the investments and recognize that an infusion of resources will require system-wide capacity building across providers and agencies alike, including DHS and DCHA. While I'm proud of the investments Council has made into vouchers, we have heard some critical barriers to implementation. First is staffing. Even before the pandemic, we have heard concerns of fatigue in care-based professions due to poor working conditions, insufficient support and training, minimal room for professional growth, and low pay. The pandemic amplified and exacerbated this exhaustion. We have heard of case managers leaving their jobs and seeking other careers out of survival. Not only is this loss of professionals generally unsustainable and unfair to the hardworking people who devote their lives to the service of others, it also limits our ability to provide good care to those in need, including voucher recipients who can't complete their lease-up process without case managers. Fewer case managers slows the timeline for residents moving into housing using the investments we have made. Second is voucher amounts. We have heard from residents in DHS's homeless services system who have encountered many layers of difficulties accessing housing. After enduring the trauma of homelessness and feeling a sense of relief with getting matched to vouchers, residents are having trouble finding units suitable for them because the voucher amounts do not match the requested rent of the landlord. A recent Street Sense and DC Line article laid out how DCHA determines how much a voucher is worth, including a rent reasonableness determination meant to ensure landlords are not charging voucher recipients higher rents than similar units rented by non-voucher tenants. However, HUD's recent audit of DCHA found that DCHA, quote, does not conduct annual rent reasonableness assessments or perform rent reasonableness determinations, end quote, in compliance with HUD regulations or in line with the local rent reasonableness process outlined in the DC municipal regulations. This deficiency creates barriers to housing applicants, causes existing voucher holders stress over whether their max voucher amount will continue to cover the cost of their rental units, and limits our ability to prevent landlords from exploiting the voucher system by overcharging. Inconsistent policy also reduces landlords' trust in our housing supports. In light of those concerns, I look forward to hearing from DHS Director Zeilinger and DCHA Deputy Director Spann. I know DHS has taken some steps to recruit and retain staff. I'd like to hear more details about those efforts and their effectiveness so far. I would also like to hear from both government witnesses about any other barriers to matching and leasing up clients in a timely manner, efforts to recruit and retain qualified managers, plans for matching encampment residents to vouchers prior to evictions, particularly at McPherson Square, and what role our economic development agencies, such as DMPED, should play in ensuring the units coming online are open, accessible, and appropriate size for the needs of residents facing housing instability. So again, Chairperson Nadeau, thank you so much for holding this hearing. Looking forward to hearing the testimony, and I'll be jumping in and out because of other meetings.
Thank you. We've also been joined by Ward 2 Council Member Brooke Pinto.
Thank you so much, and good morning, Chairwoman Nadeau and Councilmember White. I want to thank you for holding this really important roundtable today to discuss the status of our historic investments in housing vouchers. Ending chronic homelessness has been a top priority of mine, and I know many of us in the council, and it is in reach. In FY 2022, the council approved more than 2,400 new permanent supportive housing vouchers, which is one of the greatest tools we have to house our unhoused neighbors and grant them the dignity and security of a stable home. Based on these historic investments, we have the ability right now to virtually end chronic homelessness for individuals in the district. Yet despite these efforts and these investments, our voucher utilization rate is unacceptably low. While we understand, of course, that these kinds of investments cannot be put into place overnight, we have made numerous efforts over the last year to reduce barriers to help speed up the process of getting residents into housing more quickly. We have the vouchers set aside, we have the housing units available, but folks just are not getting into housing quickly enough. And today we are asking why that is and what else is needed. I stand ready to continue to work with our colleagues to break down any barriers that are needed to get our residents into housing as soon as possible from the legislative perspective. It is already November and hypothermia season is upon us soon. I look forward to hearing from our public witnesses today, including representatives from some of our nonprofit service providers, as well as from DHS Director Zeilinger and DCHA Senior Vice President Johnson Jennings. I'm also looking forward today to exploring the challenges that we've seen with virtual inspections and whether that is a practice that should continue, as I continue to hear about challenges with scheduling these virtual check-ins and the many circumstances of habitability that really need to be seen in person, like around hot water access and mold, that's very hard to determine over a video. So I thank you all for your time today and for the compassion and empathy with which I know you all do this work and your commitment to our shared goal of housing our residents. So thank you again, Chairwoman Nadeau.
Thank you, Councilmember. Okay, so now we are going to turn to our panel of public witnesses. I will now call Karen Lundrigan, Ava, Harry Robertson, Will Doyle, Director of Housing Operations at Pathways to Housing, Jesse Rabinowitz, Senior Manager of Policy and Advocacy at Miriam's Kitchen, Robert Warren, Co-Director, People for Fairness Coalition, Lynn Amano, Director of Advocacy, Friendship Place, and Kate Coventry, Senior Policy Analyst at the DC Fiscal Policy Institute.
Good morning, everybody.
Good morning, Karen Youmbi.
I go ahead and start. I'm trying to figure out how to get my video on, but sorry.
Sure.
You guys can see me.
Yeah, do you?
There you go.
There you go. Go ahead.
Thank you. Okay, thank you. Good morning, council members. I really appreciate you guys doing this. I've been through a nightmare. I'm a voucher recipient right now. I've been through a living nightmare with DCHA. They continue to commit gross illegalities against me. They treat voucher recipients really horribly. I had a woman with DCHA named Kalia Payne. She sent me a request for termination notice. There was no proper investigation done into my situation. This is all based on hearsay. The irony is that Ms. Payne used to work at the Housing Opportunities Commission, and I have a pending legal matter with them, and where she's a witness. So this is a huge conflict of interest. She's also been calling the director of HOC, telling them personal information I have on file with the Housing Authority that they're using against me in my other case. We've also submitted reasonable accommodations to DCHA that they're illegally denying, and they're not following the HUD joint statement that they're supposed to. It's honestly, it's really overdue time that something's really aggressively done about the DC Housing Authority to get much more needed enforcement and accountability. Just submitting, I see scathing reports all the time from HUD, and it doesn't go beyond that though. And to me, that's just not enough anymore. I still can't even get a copy of my entire file, although my attorney and I have been asking for months and months. We're told that you have it and we don't. They keep coming at me with bogus termination hearings. If I speak up for myself and I make a comment, they get angry. They go to the Office of Fair Hearings and they send me another termination notice. And to me, the laws must change, you guys. I think that in order to take somebody's voucher away, especially in today's climate, with the homelessness the way it is, there needs to be reliable evidence before you can send somebody a notice, say, we're going to take your voucher away. Evidence, where's the evidence? It needs to be reliable evidence. And also to me, the voucher recipients based on hearsay from a landlord can have their voucher taken away. But what about enforcing it when the landlord commits gross illegalities against the voucher recipient? What about when the landlord is retaliating and discriminating against a lot of us? I'd like to know what can we do to have our rights enforced other than being told, well, you got to move or we're going to stop paying the rent. That really doesn't solve the situation. And I just write, you guys really, I really hope and pray that the laws need to change here, whether it's the Office of the Inspector General or somebody that has the power to really get in and force accountability with DCHA. Because it's been years and years and years, and I don't see much changing. To be honest with you, I just wrote this up. We had a meeting with my attorney several months ago with Rachel Joseph and Lori Bonds, and Rachel Joseph was so rude to me. I even had to tell her, don't talk to me like that. Lori Bonds sent me a very unacceptable, unprofessional letter. I have to tell you guys, DCHA has been the source of my trauma. They have done nothing to help my trauma. And I consider myself to be a responsible, good person. And it's been a literal nightmare since I've been dealing with DCHA. We don't get responses. the disorganization factor is off the charts. My attorney's been trying to get records from them. They don't respond. They break the law all the time. They do illegal things every day. I can't even describe to you how beyond exasperating what it's been like for me with them. Okay. I communicate with people that don't respond to me. I put calls in, messages aren't returned, mistakes made left and right. It's, honestly, maybe an advisory committee can be formed to see about getting some much more needed transparency. The laws need to change is what I'm saying. I don't know who does that, HUD, the Inspector General, whoever may be able to do that. Because I think that not nearly enough is being done right now. And I think that's why the DC Housing Authority, year after year, they keep doing the same thing and getting away with the same thing. And I know HUD oversees them, but HUD, I'm not too keen on them either. And I just found out that Carol Punner, who used to be the vice president of DCHA, is now working at HUD. And I had some issues with her. So I feel like I can't even go to HUD without that being biased, So to tell you guys, honestly, I'm very exasperated right now is an understatement. Lawyers feel the same way. Based on these termination hearings, they have to go to the appeals court to overturn voucher recipients, and they're dragging it into the appeals court. The court systems back you up. It's a mess. And it's really important for me to tell you this. There's got to be an answer somehow, some way about the laws changing. And I'm sure you guys are aware that this is now the second time in 2 years that the Office of the Attorney General is suing the Housing Authority. So it's time something has to be done. Thank you guys. I appreciate you listening to me.
Yeah, for sure. And we'll follow up with you after the hearing on your particular case. And I think we can work with you and probably Jenna at the Housing Authority on that. So, and I know they're listening and watching. So
thank you, Councilmember Nadeau. Thank you. Thank you, other council members, Robert White. Thank you, everybody.
Thank you. Okay, Harry, you're next.
Good morning, panel. Good morning, people. How are you guys doing? Can you hear me?
Yeah, you sound great.
Okay, great. I'm here because I'm one of the residents that's over at the PEP-V site at the Fairfield Marriott. And I arrived there on March the 17th, and I'm very grateful and thankful that Marion Bowser gave people like myself a place to get ourselves together and get off the street. And I say that to say, since I've been there since March 17th, I was able to obtain a job that's walking distance in the area where I tried to move to. I was voucher ready 4 months ago, but I didn't have my voucher briefing until October the 11th. And the very next day, me and my caseworker from Marriott's Kitchen, Miss Shannon Maris, applied for an apartment where it's accessible for me and my service animal that I have with me at the PEP-V site to be in walking distance from my job. And the area is called Brooklyn. And not only did I help advocate and have them change the policy of the voluntary site agreement that was just given to me yesterday, the previous site agreement had been outdated. So I was given the paperwork yesterday from the MBI CEO, Miss Black, who complimented me on helping change the site agreement and having an opinion about it. So not only did I do that, now I'm in the process of advocating for myself and others who are like me, are trying to move somewhere where it's closer to their job. And what I found out, the panel, what I found out was on October the 12th, the day after I had my voucher briefing, that we submitted an application over at the property called the Chase at Bryant, which is walking distance from the RAP Incorporated drug treatment facility where I work at. And they have an animal park. They have a dog park there. I wanted to be somewhere closer for me and my animal. He can go do his thing and I can do my thing. And what happened was we submitted the application. Everything went through. I passed the screening for me and my animal. We passed the screening, but we thought it was a go from the housing authority place. But once we found out that the reasonable amount of rent that's in that area for the Brooklyn area hasn't been updated. They were at $1,400, I believe, and now the apartment complex, the management company was asking for $833 more than what reasonable rent was from the housing authority people. So I was denied there. And so I went to the council member's office on Monday to advocate for myself and for people like me that may want to go to an area where it's convenient where they work at. So I went down there on November the 1st, which was Monday, and I stopped at council member. The first stop was at council member Allen's office at Ward 6, and a gentleman by the name of Eric Somney that worked for him had got involved. Then I went from there to council member McDuffie's office and got in touch with Kelly Sislow. And the person that really's been driving and helping me is Robert White's office, Councilmember Robert White office. Her name is Caitlin, and I hope, forgive me for pronouncing her last name. Her name is Caitlin Chichola, like Casanova, but she's been very inspirational in helping me go through this process. And she had a lot of information because there are things that not allowing us with vouchers to go to. Yesterday, just even yesterday, I went to another property that has the amenities for me and my service animal. And we thought everything was a go, but the reasonable rate for that particular area, even walking distance, we're talking about the same ward, Ward 5, even walking distance, it increased by $24.67 was the reasonable amount of rent that housing is willing to pay for that particular area, which is Eckington. I believe I'm pronouncing that right. And also what we found out was the property that where I went to was named 1 on 501 on it's on the address is Harry Truman Drive or Harry Truman Way, and the rent was $2,710. And my caseworker was on the phone with me, asking them, do they negotiate the rent there? And I was willing to take a handicapped unit to go in there, you know. And they said, no, we don't. We only deal with people on market rent vouchers, you know. So that means they were charging me the same if they would charge somebody else that had a full-time job and all the other stuff. What I didn't get was that if you say that you have affordable units and you may have a few there, why are people like myself that contribute and just trying to do the right thing, trying to be helpful in the community and make it a diverse community, why are we being not able to go to those places?
So Harry,
and that's my thing now.
Harry, I'm going to stop you now because we want to make sure we get to everybody, but I'll have a couple questions for you when we get to questions, okay?
Yes, ma'am.
All right. Thank you for your testimony. I appreciate it. Will? And I'm going to be keeping time manually for now because the whole timer system went down all across the universe. So I will let you know when you come close to your time. Go ahead.
Yeah, good morning, Chair Nadeau, council members, and council staff. My name is Will Doyle, and I'm the Director of Housing Operations at Pathways to Housing DC. Our mission is to end homelessness and support recovery for people with complex health challenges using the Housing First model that we brought to the district in 2004. Since partnering with the Department of Human Services through their permanent support housing program in August 2008, we have ended homelessness for 628 of our most vulnerable neighbors through the program. We have grown from the original contract of 125 clients to serving over 520 clients currently. Growth of our program continues to be a goal as part of Pathways' mission. In analyzing our ability to do so, I identified current barriers such as, number one, there have been significant payment delays as we transition to Medicaid billing, which impacts our cash flow. This transition has also been a huge administrative burden, which reduces and delays our capacity to take on new unhoused clients. Number two, the new human care agreement effective July 1st is still being implemented. As a result, we cannot adequately assess our ability to grow under this new human care agreement. Number three, the DCHA voucher processing timeframe has averaged over 90 days since May 2022, and there have been increasing delays in the inspection process for clients working on a first-time move-in. Number four, Since the new referral process under Medicaid billing was implemented in August 2022, we have not received any new referrals for the 3 vacancies we had as of August 31st. That number has now grown to 7 vacancies. Number 5, the contact requirement for us to bill successfully for PSHP clients experiencing homelessness doubled as of July 1st, compromising the financial ability for agencies like Pathways to expand our programs at larger scales. While these are actual barriers and addressing them is needed to support our shared goals, historic housing investments are only successful when we make historic changes to the systems involved in housing clients, the PSHP. When relying on billing requirements alone, the highest yearly growth of our PSH program was 39 homeless clients. However, with funding under the emergency housing voucher expansion, which directly reimbursed us for staff salaries, we were able to add 145 clients to our program between July and December 2021. Why were we able to grow so significantly with the EHV expansion last year? Precisely because we were reimbursed for salaries and not based on client contacts. Reliable funding is critical in being able to take on a large number of unhoused clients at once in the context of imperfect systems. This worked under the emergency housing voucher expansion, and if we want to use all available vouchers to end homelessness for more of our neighbors, we need this investment again. In order to grow substantially, we also have to hire both case managers and supervisors. DHS has made changes to the case manager requirements that have resulted in an ample pool of applicants. However, the current requirements for supervisors limit this pool. Only individuals licensed in DC as licensed independent clinical social workers, licensed professional counselors, and licensed graduate social workers are eligible to be supervisors. While DC has a shortage of all 3, we have recently learned that the shortage of social workers is a result of the use of the Association of Social Work Boards biased licensing exams, which are required for licensure in DC. After much pressure, they released exam pass rate data on August 5th, 2022, covering pass rates from years 2011 to 2021. While the first-time pass rate disparities are even larger, the eventual pass rates provide information on who was able to successfully obtain licensure and work in DC. The eventual pass rates for DC test takers from 2011 to 2021 were 88.9% for white test takers and 33.3% for Black test takers for the bachelor's level exam. The rates were 99.2% for white test takers and 70.5% for Black test takers for the master's level exam. The rates were 96.9% for white test takers and 75.4% for Black test takers for the clinical level exam. The Association of Social Work Boards states that their mission is to advance safe, competent, and ethical practices to strengthen public protection. However, there is no data showing that their exams actually serve this purpose. The data we do have shows incredible disparities in pass rates due to flaws in the exam that have caused a shortage in social workers in DC. If test takers in all race and ethnic groups from 2011 to 2021 passed at the rate that white test takers passed, DC would have 20 more social workers licensed at the bachelor's level, 285 more social workers licensed at the master's level, and 169 more social workers licensed at the clinical level. Additionally, while social work degrees are not required for our case manager positions, licensure is required to work in DC for anyone with a social work degree. We have had 69 unlicensed social workers apply for our case manager position since COVID started in March 2020, but could not consider any of them. We are definitely seeing an impact of the biased exams on the workforce needed to fully staff our permanent supportive housing program. Despite this barrier, Pathways has ended homelessness for 244 of our clients since March 2020. I'm asking that you support legislation to remove the Association of Social Work Board exams from DC social work licensing regulations and to work with PSH providers to implement creative solutions for short-term, large-scale expansion to utilize existing vouchers. Thank you for holding this hearing.
Thank you very much for your testimony, Will. Jesse.
Good morning, Councilmember Nadeau and members of the committee. My name is Jesse Rabinowitz, and I'm a proud Ward 1 voter. Today, I'll be testifying on behalf of Miriam's Kitchen, where we work to end chronic homelessness. My testimony will focus on mounting frustrations over the too slow implementation of FY22 vouchers, as well as tangible solutions to get our unhoused neighbors housed as quickly as possible. While there's clearly much room for improvement, we must be clear. The slow rollout of vouchers is not because Housing First doesn't work. It is not because clients do not want housing, or because case managers are not working as hard as they can to navigate the maze of bureaucracy. Rather, these delays exist because, while DC finally has the resources to get Close to ending chronic homelessness, more political will and imagination are needed to cross the finish line. The solution to homelessness remains housing. It's time to move with urgency. Thanks to Councilmember Nadeau's leadership, the DC Council passed the Hearts and Homes Amendment in 2021, which led to a budget that included 1,924 locally funded PSH vouchers for single adults. By slightly increasing the taxes on DC super wealthy, the DC Council dramatically increased resources available for ending chronic homelessness. This funding, combined with federal funding, set the stage for DC to near our goal of ending chronic homelessness in the very near future. Unfortunately, due to myriad challenges and delays, often at the DHS and DCHA levels, DC's used only 13% of the available PSH vouchers in FY22. This means that 258 individuals experiencing chronic homelessness moved into PSH. Or, said another way, nearly 1,700 medically vulnerable individuals who have been matched to vouchers continue to experience homelessness despite the fact that a housing intervention exists and is funded for them today. This looks like clients who have lost faith in the housing process and have disengaged from their case managers. This looks like case managers whose days are consumed by telling their clients to keep waiting in the hopes that the government will act with urgency. And this looks like neighbors who are confused as to why they continue to see unsheltered homelessness despite historic investments in housing. To be certain, we never expected the rollout of the most vouchers ever funded to be easy, but we have long seen these barriers coming. Capacity concerns have been raised by the administration and were included in Homeboard DC 2.0 published in July 2021, and have been the discussion of dozens of ICH meetings and several council hearings. As COVID-19 showed us that when governments want to, they can quickly staff up, build entirely new programs, and expand services for tens of thousands of people. Why are we unable to apply the same whole of government approach and urgency to utilize desperately needed housing vouchers funded in a budget that was finalized 18 months ago? I will now discuss areas for growth for both DCHA and DHS. My testimony is informed by hours of conversations with clients and providers, as well as a survey that Miriam's Kitchen sent to all PSH providers to hear directly from them what their implementation challenges are. Before we move into recommendations, I want to name very clearly that by and large, we have shared these recommendations with agencies, with the council, and with the public often over a year ago. I'm tired of saying the same thing while not much seems to change. If I seem frustrated with my testimony, it's because I am. For the first time in 8 years that I've been doing this work, we have a tremendous number of resources at our disposal to make real and lasting change for our unhoused neighbors. Money is not the problem. A lack of urgency and political will is. We must remember that a client assigned to a PSH voucher is assigned because they have a unique medical vulnerability. Waiting 6 to 9 months for housing is not acceptable. I've attached additional client stories to my written testimony to illustrate the harm that these delays are causing. The recent HUD audit of DCHA was damning, but not surprising. One central area of concern to discussion is the time that DCHA takes to process voucher paperwork and applications. Concerningly, of the 1,700 vouchers that remain unused in FY22, over 1,000 of them have not come across DCHA's desk. We're thrilled that just yesterday, procedures were released that enable clients to self-certify their identity. While this is welcome news, it's worth noting that it was included in the FY22 BSA and took 18 months to implement. I remain skeptical that DCHA has the capacity to move these vouchers with the urgency required. Given the recent HUD and mounting concerns, I strongly urge the DC Council to explore splitting DCHA into 2 agencies, one that deals with federally funded programs and one that focuses on local funding, like the very PSH we're discussing. This would not only increase council oversight for locally funded programs, it would give DCHA the ability to narrow their mandate with the hopes that this would set them up for success. In the interim, several operational changes must be made to ensure that DCHA moves with the urgency needed. These are discussed more fully in my written testimony. These include dramatically and quickly improving communications between all stakeholders, processing voucher applications within 2 weeks, and creating a team of DCHA staff dedicated to process DHS vouchers. Now on to DHS. The scope of DC's homeless crisis is great, and we are asking DHS to address the result of many broken systems and decades of underfunding. This work is not easy. We thank DHS for remaining our steadfast partners in ending homelessness. While we do not always see eye to eye, they are responsive to our concerns and dedicated to this work. While some improvements have been made and many more have been promised, significant roadblocks continue to stymie voucher implementation. We are particularly grateful that after over a year of advocacy, just yesterday, DHS released a public dashboard so stakeholders can track voucher utilizations. As our organizational partners have already testified, staffing remains a concern. I will focus on a few of those things. It's true that providers have had a hard time staffing up, but it's important to put this in context. Hiring is hard everywhere, and this is even more true in fields like case management, where the work is incredibly challenging and the pay is substandard. It's beyond time to embrace new ideas, such as intentionally hiring people with lived experience of homelessness and exploring alternate social work supervision possibilities. It's worth noting that when Mayor Bowser wanted to increase staffing for MPD, which is already overfunded, she presented the council with a package including tens of thousands of dollars in signing bonuses, rental and tuition, and assistance and other perks. Why is hiring case managers needed to end homelessness not treated with the same priority? In July, DHS announced that providers would be reimbursed for signing and retention bonuses. However, these funds have yet to materialize, and we are now learning that they might remain tied up in contracting until January. Concurrently, DHS shared that they would begin reimbursing providers for the cost of amenity fees and other fees beginning in August. Unfortunately, providers have yet to be reimbursed for the tens of thousands of dollars. This is not sustainable. While we thank DHS for working on improvements, we are concerned at how long these changes are taking. Furthermore, even though the fiscal year started in October, at least one provider's contract was not executed until July. The 9 months interim could have been used to recruit staff. And as our provider survey revealed, one provider has 15 staff ready to start to house over 200 people, and they've had this staff for 3 months, yet they've yet to be assigned clients because they've not been trained in a particular software element. Ending homelessness needs to be a priority, not just for DHS, but for Mayor Bowser and the DC Council. Just like Mayor Bowser used her platform to recruit police, so too must she use the powers of her office to ensure that DHS and homeless services providers have all the tools they need to implement these vouchers. Thank you for the opportunity to testify today, and I look forward to answering any questions.
Thank you. Is Robert here? No. Okay, Lynn.
Thank you. Hi, good morning, Chairwoman Nadeau and members of the committee. Thank you for giving me an opportunity to testify. And I'm Lynn Amon, the Director of Advocacy for Friendship Place. As a service provider for those experiencing homelessness, we do enjoy a strong working relationship with DHS, and we are grateful for the continued collaboration. As a PSH provider, though, there are obstacles to hiring caseworkers and case managers, which have slowed the system's ability to assign clients to providers. As we've mentioned in the previous testimonies, we would like the Council and DHS to ask Director Lewis at DOH to expand the types of certifications that qualify staff to supervise case management teams. Both Maryland and Virginia recognize the CPRP, which is the Certified Psychiatric Rehabilitation Practitioner, as qualifying certification for supervisory responsibilities and Medicaid processing. In addition, DBH accepts the LISW certification, but DHS has not specified LISW as an acceptable alternative to LICSW. This added flexibility would expand our pool and therefore facilitate hiring of new staff for these positions in our PSH programs, and it is something we have run into as a problem. In addition, the successful implementation of last year's promised sign-on and retention bonus would make us more competitive in an environment where our contracts stipulate much lower salaries than those offered by DBH and other DC government agencies. We do share continued frustration with the other providers and the broader community at the 179-day time lag between match and move-in reported by DCHA, the low percentage of move-ins completed for the 2,400 available vouchers, and the lack of transparency in the process. DCHA and DHS need to work collaboratively to present a cogent master plan for effectuating these vouchers. There are many suggestions and improvements encouraged by advocates such as those mentioned previously, and this is not the first time DCHA or DHS has heard these suggestions. For almost 2 years, we have been asking for the creation of a single universal voucher portal. I understand from Jesse that part of that process may have been released, but what we'd like to see is one that is accessible by participants, providers, landlords, DCHA, and DHS. And every provider that we have spoken to, as well as the landlords and clients, see that this development could expedite all aspects of the system. Colleges and universities have systems that allow students to register for classes, communications between professor, staff, and students, manage finances, allow parents access, all while protecting the privacy and sensitive information of the students. So there's no reason that DHS and DCHA could not create the same type of transparent portal. The portal allows real-time secure access, and clients could log in to see all parts of where their application is in the process. It would help PSH clients who definitionally have disabling conditions by allowing providers to help them complete the process, which is often a challenge that we face. In addition, it would provide the much needed transparency and automatically update points of contact, which has been sort of a moving target over especially at DCHA. And we could avoid situations where clients time out and must start the process over. The current communication system isn't working well, and re-engaging clients who've been chronically homeless is difficult, delicate work. Long periods of not knowing their status or waiting on decisions without transparency results in disengaged participants who lose hope and they may not ever re-engage. This process is a primary cause for staff frustration and disillusionment, and as we fight in this fight to end homelessness in DC. The coexistence of thousands of unused vouchers and individuals still experiencing homelessness is excruciating for those of us who are working in the field. We need you to implement these changes and those suggested by other advocates as soon as possible. Thank you.
Thank you for your testimony. We will now hear from Kate Coventry, who is our last public witness on this panel, and Councilmember Henderson has joined us and will be recognized for an opening statement when we begin our round of questions. Go ahead, Kate.
Thank you. Chairperson Nadeau, Councilmember Henderson, Councilmember Pinto, thank you for the opportunity to testify today. I'm Kate Coventry. I'm a senior policy analyst at the DC Fiscal Policy Institute. DCFPI is a nonprofit that shapes racially just tax, budget, and policy decisions by centering Black and Brown communities in our research and analysis, community partnerships, and advocacy efforts to advance an anti-racist, equitable future. I'm here today to ask DHS and DCHA to outline an action plan for implementing the historic investments made in the Homes and Hearts Amendment Act of 2021, given that the government has leased up only 20% of the tenant permanent supportive housing vouchers for individuals made available in fiscal year 2022. I also ask the agencies to commit to timely and regular updates on initiatives in progress, including the release of core implementation metrics so that stakeholders can monitor implementation. I just want to point out that Black residents bear the brunt of this delay in voucher implementation. 89% of unaccompanied adults counted in the district in the 2022 point in time were Black. This is a result of enduring legacies of structural and individualized racism that for years prohibited Black families from equitably accessing the housing and employment markets. This has led to a current wealth gap as wealth accumulates over generations, and the historic denial of homeownership opportunities to people of color through discriminatory lending practices means that most Black residents, even middle-class residents, are renters, while rental costs in districts have been soaring. DCFPI thanks the Council for passing Homes and Hearts, which imposes a modest increase in the income tax rate for DC's wealthiest residents to make historic investments in affordable housing and other transformative programs. The program funded 1,924 permanent supportive housing vouchers for individuals in FY 2022. This investment was added to an additional 532 new PSH slots for individuals that were funded using federal emergency housing vouchers. This created a total of 2,456 new tenant vouchers. Given that this was by far the largest number of newly funded PSH slots ever, DCFPI and other advocates expected that implementation would be challenging, anticipating that agencies would need extra time. But implementation delays are much worse than we ever expected, with only 258 of the 1,924 locally funded vouchers and 371 of the 532 EHV vouchers leased up. At this rate, the agencies will need 35 months to lease up all the FY 2022 vouchers and an additional 8.5 months to lease up the 500 locally funded PSH vouchers. DCFPI wants to acknowledge DHS has been facing a number of challenges: COVID-19, monkeypox, migrant buses, but we must treat these implementation delays seriously because they have real cost for the individuals experiencing them. DCFPI asked the agencies to release an action plan informed by stakeholders to fully utilize all the FY 22 and 23 resources. The action plan should include specific steps each agency will take, and it should include deadlines for each step and updates on initiatives that have been announced yet, but not yet implemented. They should also outline how they're addressing delays related to the switch to Medicaid funding for PSH. Medicaid funding requires independent evaluations from an agency that is not your PSH provider. DHS has decided they want to perform these assessments, which is fine as long as they have the staffing sufficient to do these assessments in a timely fashion. We are hearing from providers that they are waiting for people's assessments, and that is part of the reason why people aren't getting into housing. We are also recommending the agencies implement a boot camp, something they've used previously to tackle veteran homelessness. The boot camp brings together decision makers and government agencies, service providers, and individuals with lived experience to systematically investigate issues and develop solutions. The only way we're going to get through this is by coordinating together. We'd like to acknowledge that DHS just released a very nice looking dashboard, and in my written testimony outlines the positive parts. I want to say this is a good start, but we are missing some key information. Like, for example, we have the total time to lease up, but not the timeline for each step. And that's the kind of data stakeholders need in order to make good recommendations. So we recommend either the dashboard be improved, or there be a separate dashboard that is aimed at stakeholders like providers, DCICH members, and the council. Also just would like to document we're not getting any information on racial and gender background of people leasing up, and that's important metrics to follow. And just to say, we envision a future where no one is homeless, and we actually have the resources to make that happen, to have no one chronically homeless in the district, but we have to get these resources out the door. Thank you.
Okay, just making sure we didn't have anyone else join us. Oh, I think Robert is here, team. Can you promote him? Great, Robert, you're up now, so you can unmute yourself and turn on your camera.
Thank you. Can I just, I need to turn my camera off though. I'm sorry.
That's okay.
Thank you. Good morning, Chairperson Ado, members of the Committee on Human Service and DC residents. My name is Robert Warren. I'm a lifelong DC resident and one of the founding members of the organization People for Fairness Coalition. I would first like to start off with acknowledging and thanking the Committee on Human Service for the investment that this City Council has budgeted, and you, Chairperson Ado, with a record number of housing vouchers that has had an impact on housing underserved communities of lifelong and long-term DC residents who are experiencing housing instability. I also like to acknowledge the Department of Human Services and other service providers like Miriam's Kitchen, Pathways to Housing, and United Planning Organization, and other organizations that have been understaffed due to many service providers as we navigate this public health emergency, COVID-19, which has also brought to light a lot of inequities. Over the last 2.5 years, PFFC, along with other coalition partners, Ward 6 Mutual Aid, Serve Your City, and Ward 2 Mutual Aid, along with student bodies at GW and other community members, have conducted COVID-19 outreach to homeless encampments, providing much needed supplies. We welcome the mayors and the Department of Human Services encampment protocol in housing individuals, placing them into PEP-V shelters who are matched to CSA or collaboratives to process their vouchers for housing placement from PEP-V. Somewhere along the way, the ball got dropped. Individuals are suffering for a long period of time, housing insecurity and losing hope, even though there's a record number of unsecured vouchers for these individuals to be placed. Individuals that are matched already aren't even receiving any type of services and case management, even very minimal and effective communications with their clients, consumers, and participants. Something drastic needs to happen to change the ineffectiveness that we are seeing today. I walk by talking to so many housing insecure individuals, long-term residents of DC, of District of Columbia. It is sad to see more encampments popping up. homelessness is on the rise again, and the city council and the mayor needs to make sure that housing placements are available in all 8 wards. One of PFFC coalition partners, People Power Action, in their vacancy reduction plan had identified 17,000 vacant units in DC. There must be some form of protocol to make these units readily available to lifelong DC residents and long-term residents experiencing housing instability. This is a racial equity issue that must be addressed. Thank you for this opportunity to testify. Yes, I'll be very happy to answer your questions. Thank you.
Thank you so much for your testimony. Okay. So we have Councilmember Henderson, Councilmember Robert White, and Councilmember Pintos joining for questions. So the order we will go in is committee membership and then order of appearance. So that'll be Robert White, then Brooke Pinto, then Christina Henderson. I'm going to start with around this time. Karen, we talked as you finished your testimony, so we're going to follow up with you on your particular case. I wanted to ask Harry, are you still with us, Harry? Make my screen so I can see everybody. Harry, if you're still with us, I did have a couple questions for you. Just turn your camera on if you want to participate in the Q&A. Okay, so you raised social worker licensing reform essentially, and then also issues with contracting, and your recommendation is payments for salaries rather than human care agreements. With the social worker licensing, you listed a number of things that I will talk to the agencies about, but I just wanted to make sure that I'm not missing any key points because I'll carry this forward to the government witnesses.
No, that was it, but it's really about the phase of housing navigation while we're helping people to get housed where that work under EHV, the funding directly, because of we see so many challenges in making it work that we know it's very unpredictable.
Okay. Jesse, I took notes on, okay, specific contacts at the Housing Authority and a dedicated team. And I know at the beginning of 2021, when we had the leadership change at the Housing Authority, they did separate out the teams for local versus federal, which is not the same as DHS versus federal. So are you were saying even within that, segmenting further, so like LRSP is sort of an aside from what we're doing with the DHS?
I think so, because of all the great changes the council has made, there really are different eligibility requirements for DHS. So it makes sense in my mind to have a dedicated team. I think that would also help with communication channels, which continues to be a large issue. Okay.
And we're going to drill down on the turnaround times, and also reimbursements and bonuses. Okay. Lynn, okay, so I'm going to be asking DHS about LISW versus LICSW. Okay. And also about the portal. Okay. And then Kate, I like the idea of an action plan. So we can definitely talk that through. And then would you suggested either tweaks to the dashboard or a separate dashboard for providers? Would a portal satisfy this?
I put the kinds of data I wanted in the testimony, and I could understand that some of that data would probably not be interesting to the public, but it would be interesting to the people who are actually implementing. So I defer to the agency. I don't know what the ease of doing various solutions is, but it's just hard not knowing where people are stuck to make good recommendations of how to get things unstuck. I also just say, like, I think it just got posted, so there could be some things they're going to add to it, because that's often what happens with these sort of things. I'll just say too, like, there's a lot of new leadership at the Housing Authority. which is also just sort of affecting like how we get information.
Okay. Helpful. And then Robert, thank you, as always, for your testimony and your leadership. And look forward to working with you on improving these things. All right, so I'm going to kick it over to Robert White for a 10-minute round, and then we will continue on to our next colleague.
I just want to quickly say thank you. I feel heard, Councilmember Nadeau and everybody else. Thank you.
Thanks, Karen.
Councilmember Nadeau is good for that. So thanks for noting that, Karen. Harry Robertson, I particularly appreciate your testimony and you being here. You mentioned in your testimony that you are staying in a Pep V hotel. What are some of the concerns that you've seen, or I guess what are the good things that you're seeing there, and what are the concerns that we should be aware of?
Well, good morning, Mr. White. I would like to say that I've been a resident since March 17th, and my stay there has been, how can I say, it's been difficult for me, to be honest with you. It's been very difficult for me, to be honest with you, because the moment that I arrived there, me and my service animal, we thought that we were in a safe community, you know, but it didn't turn out like that. You know, as time went on there, and I didn't want to get on this subject, but it's just a coincidence that you asked me that, is that we had to meet and a few other residents, and I'm gonna say it was 4 of us, and I made 5, and we had to bring awareness to the CEO of MBI Health Services and the DHS staff, which is Dina Hassan, who oversees that Pep V site, about some stuff that were happening to not only myself, but other residents that were there. It wasn't a place of peace. It wasn't a place of serenity. It wasn't like that. You know, what I found out from being at that site, that DHS has contractors that are contracted through there to perform duties of to help people like myself that are dual diagnosed, and they didn't have the capabilities of meeting people where they were, and each individual is different, you know. And what I found out is that they mistreated us, they bullied us, and some people were thrown out of the Pep V site because they didn't do what the people that were lead people said to do. So it was almost like being in jail, to be honest with you, Mr. White. And I hate to say that, but we were advocating, the 5 of us were advocating for change. And it took me months of trying to reach the McDuffie's office, the mayor's office. I talked to Ms. Nokomis Hunter. I talked to Kwame Booker. I talked to David Ross, the chief of DHS of that department. And we had a meeting about maybe a month and a half ago. And there was a 3-hour meeting. And that 3-hour meeting came out of that 3-hour meeting. It came out of, we asked for several individuals that work for that contracting services. We asked for them to be removed because of the mistreatment that they were doing to me and other residents that are no longer there. And they were removed. I'm sorry about that, guys. But
sorry, I have a dog too. It's all right.
They were removed from the site, but not immediately. And something happened that same day, the very next day after I asked Ms. Dina Hassan to remove these people while they're under investigation. Mind you, I had to go through DHS Internal Affairs Unit. And that's who started the investigation, the Internal Affairs Unit, and a woman by the name of Paula Seals. She was very helpful. She took our complaints and she forwarded them on to her superior, which was Mr. Parat of the Internal Affairs Unit. But even doing all that, today, the woman by the name of Paula Shields is no longer at her post. She's been on administrative leave for trying to get our point across and getting our voices heard. And that's sad to say, because she was helpful in doing her job and getting that meeting, that 3-hour meeting with the heads of those departments to that meeting.
Okay.
And today, one of the persons that was with me, one of the 5 that was with me, she got placed out of the Pet V site, allegedly from one of the persons that we were alleging to have removed from the site the very next day. And she's not back at the Pet V site. She should be back at the Pet V site. And that's where we're at. So all I can say is that every department so far has hit the reset button upon us having that meeting. And that means MBI Health Services, the DHS staff, and even the clients are aware of the atmosphere today. It's a more pleasant atmosphere today than it was 7.5 months ago. I must say that.
I'm glad to hear that. And it sounds like when you went to DHS to resolve the issue, that's when things started resolving. Is that right?
Yes. When I went to, it started when I believe when the Internal Affairs Unit got an email from Nokomis Hunter from the mayor's office.
Okay. And we need to look into what happened with Ms. Shields, who you say was helpful.
Correct.
Okay.
Correct. Correct.
Really appreciate you sharing that. It really helps give us perspective and shine a light on some things that we're not doing well and some things that are going well. So this is particularly helpful, and I really appreciate it. For other witnesses, I want to thank you for recommendations as to how we can improve. Obviously, the issue with case managers is a significant one. And the committee, it looks like it's taken seriously, exploring that and looking at what other jurisdictions are doing. So thank you all for that. And I know that Caitlin Kochalova on my staff has been in email threads trying to help with this as well. So we'll continue to assist the committee on this. Kate Coventry, quick question. You mentioned in response to Chairperson Nadeau that just with turnovers at the Housing Authority, you've had some challenges getting information. Is there anything that the committee or my office can do to assist there?
There's just been a lot of turnover at DCHA, and now they are focused on the HUD audit, and they have not been participated as much in the Interagency Council on Homelessness as they might have done in the past. So I don't want to lay blame at anyone right now, given all that's happening, but it is very hard for us to know why things are taking as long as they are. And I'll just point out, Jesse pointing out that it was in the 22 BSA to self-certify factors, and we're just now implementing that. And I don't have the evidence, I'm sorry, in front of me, but when I testified a year ago, I said, we know this works because we saw it work with our emergency housing vouchers and how much quicker it was to be able to self-certify. So it feels like we make recommendations in public, and we believe the agency is here listening, and then we don't really know why they don't want to do it. And then we argue about it. And then in fact, it is the law. So they end up having to do it. We could have self-certified 18 months ago. Yeah. And I'll just flag for everyone is that as we start housing more people, we're going to house folks that have bigger barriers or who've been housed before and are now unhoused again, right? We are, who often is left is more difficult people. We need to be bringing our A game.
Right.
And folks who've just really lost faith in us as a system, they're matched. they haven't moved forward. I'm working on a paper, and I've been interviewing people in PSH, and their case managers are changing constantly, and they are feeling really unsupported, which I don't believe is our intention, but is what is happening.
See, the committee finally got a timer to work just for me. So as I'm running out of time, I will say again, I'm grateful for this feedback and for this hearing. When Councilmember Nadeau led the council in getting Homes and Hearts over the finish line, and the work that you all have done to help and get that there, it was a big deal. But sort of getting that bill and getting the funding is one step. Implementing it is the more important step, and it is going to require us to be nimble, to be flexible, which are not sort of the key ingredients of government, but it is going to require us to operate differently, and for us to try some new things, even understanding that some of them may or may not work, but we've got to try some new things and keep coming back to the table to examine where we are. So again, to this panel, thank you all so much, and Chairperson Nadeau, thank you for holding this hearing.
Thanks, Councilmember. Councilmember Pinto had to pop out for an 11 o'clock meeting, so we're going to go to Councilmember Henderson. And if you have an opening statement, you can do that before we start your clock.
Oh no, let's just get into it. First off, thank you so much for all of the public witnesses for testifying today. Mr. Doyle, I wanted to come back to your testimony, and I think Ms. Amano, you also mentioned something similar, but I don't have your written testimony, so I wasn't able to refer as you were using LICW, like you were using a lot of acronyms there. So if you could forward your testimony to my office, I would love to follow up. And I'm saying that because for some of the folks who may be watching, the Board of Social Work is actually under a different committee. So, and I'm on that committee, Councilmember Nadeau is, but we need that information to follow up over there with DC Health. But Mr. Doyle, so this is actually the first time that I'm hearing issues in terms of this exam, because my understanding is that like 50 states use this exam as a qualification for social work licensure. Is there another test? Like, is this for example, with college for admissions to undergrad, you can take the SAT, you can take the ACT. Is there another option that someone else is using?
Not currently. I mean, what we're seeing is a monopoly and a nonprofit that is in this time frame where we have those disparities, increase their net assets by 22 million. So that is what we're seeing. I think what we're seeing is it's just there's not actually evidence of what it is supposed to do in showing the social work competence and protecting the public. There is no evidence of that. What they claim it does. Not all states, have licensure and use that test at the same level, so it does vary. But yes, they are in all 50 states, absolutely.
Okay, but Mr. Amano, there's no R, Amano. I think you were saying have DC Health come up with a different certification that could be like you don't have to go the full.
Right. So, well, at the bachelor level and master's level, we see it actually as a redundant requirement. People have passed, and there's significant requirements and supervised internships in addition to the accredited degrees people get that are sufficient at that level. And then once licensed, you're in a public database subject to DC Health's regulations, sanction. You have supervision. And you have ongoing continuing education to maintain that. And then, to move to a higher level, you would need additional requirements. So right. We do firmly believe at that level, it's absolutely sufficient that the degree and then the other requirements that are included.
Ms. Amano?
Yeah, so I think, first of all, Will and I are talking about two slightly different groups of people. He's specifically talking about caseworkers, and I'm talking about caseworker, the management supervisors. So So the supervisors have specific qualifications that DHS insists that they have in order to function as a supervisor over the caseworkers.
Okay.
And what we're asking for is for that category to be broadened to include this CPRP as one option and the LISW also. And so I'm more than happy. I did send my testimony in, so I apologize that you don't have it, but I'm more than happy to forward that to you, of course.
That would be great. I'm not on the committee. I'm here lingering. Of interest. But Kate, you had your hand up. I didn't know if you wanted to chime in on this.
Just super briefly, when DCFPI signed on to this, we did some investigation with some people at Pathways just so we better understood the argument. And I just want to say that what we were told that made sense to us was that it is different if you are providing therapy than if you are working in a DHS system with supervision and you are not providing therapy. So for us, we signed onto that letter and said, we don't want to touch that side of it. That is not our area of expertise. So you could still have a licensing exam for those folks, but that it would be different in systems like the Department of Human Services.
Yeah, I guess in terms of how you practice, it just sort of rung a bell for me, because I know we've had an issue across the district in terms of social work recruitment. Right, whether it be that in casework, whether it be in schools. And so if this is exam is an impediment, but that's something we'll talk to DC Health about. I was planning to ask our government witnesses around like what is the major barrier in terms of recruiting caseworkers. Would you all say that this is it? I mean, I had a meeting with Catholic Charities and they were talking about their struggle in terms of getting people on board. What would you say is the major barrier?
I think the licensure is part of it, but I think there are many compounding issues. As I mentioned, the work is incredibly hard and the pay is very low. I mean, a social worker in a similar role, could be making $30,000 more a year at DHS. And there's just so many, like, I hear from our case managers that the frustration at the bureaucracy is so grating that maybe doesn't prevent people from applying, but definitely prevents good people from staying in the job. But I do think the pay scale is so low that it is preventing people from applying in the beginning.
Okay. I'm running out of time. So let me ask a different question or move on to a different topic. I think it was Mr. Roberts who talked about, his challenges in terms of the voucher being large enough to cover the rent in certain parts of the city. And so, I know that, we made historic investments in terms of increasing the number of vouchers. To your knowledge, like when's the last time, well, volume was important, but also is it necessary that we raise the cap in terms of rent? Anybody? Kate, Jesse.
Councilmember Henderson, we just got through a sort of partial addressing of this point at the Housing Authority, which there's a lot there, I guess is what I'm saying. And I felt the process that we went through only really touched on part of it. And so a lot of us weren't really sure what to do because there were concerns that did not fit inside the process. So if you ask me that question, well, like, for example, that you can set the maximum rent, but then you can also look at this unit and see that I live in a unit without a washer dryer. And so that they should not get the maximum because a unit at the maximum is a washer dryer. We never got into that part of it. And we only got into what the top rent should be. And if it were me, and I hate to say this because I know the Housing Authority is overwhelmed with their audit, is that we should start the process again and really look at the various steps and talk to the community about how the process should be done and the different points.
How long did the process take the last time?
We were told there was going to be a vote in like 10 days. So then they delayed it. So I actually have no idea, but it was a real rush in the beginning. And then we actually ended up with more time, but we never got to the, are you going to actually look at compare the actual apartments, the rent reasonable part,
right?
We never got to.
Because like, it sounds to me, any reasonable person would say rents are increasing. And if we as a city are saying you should be able to live in any part of the city, regardless of your income, then we have to have adjustments on a voucher so that it allows for people to be able to lease apartments in some of these quote unquote more desirable areas of the city, whether it be something that's closer to the metro, or as someone else was testifying, like in walking distance to my job. So I'm just like, okay, like if somebody has a voucher but they can't do anything with it, then what good is the voucher?
Yeah, we're seeing a lot of clients. We're not seeing that clients aren't able to afford that their vouchers don't meet people can afford to live across the city, and it's been really great. We have a lot of people living in places that they've wanted to live for a long time, but otherwise couldn't afford to. So it's not the voucher limit that's the issue. It's like these amenity fees and these other discriminatory practices that are not that you can't pay for with a voucher, which is why we were really excited in July and August when DHS said that they would begin reimbursing providers for those things. So we started paying for them, and we have yet to be reimbursed, which is not sustainable. So I think we should have a conversation.
Oh, wait, I'm sorry. You said providers are paying those with an agreement that you would be reimbursed for the amenity fees?
Correct.
Okay, I'm at it.
And I'll just flag that it's not just amenity fees. It's like every time we start to pay a fee, the landlord comes up with a new fee that's outside of the voucher system. So trash fee, application fee, move-in fee, using the elevator. I mean, I wouldn't, using the freight elevator fee. So it's been an issue for a long time, and it evolves as we change our policies.
Mike, can I say something? I'm sorry, my raised hand isn't working. I just wanted to add something, if that's okay. Yeah, I live in Ward 3. I'm in Ward 3, so I'm in the most expensive part of DC, and I'm a voucher recipient. And rents have skyrocketed. And I'm for a 1-bedroom. And so what they're telling us we have to do is now my attorney has to do a reasonable accommodation in order to get help. And by the time we go through that process, because DCHA is so slow, if they respond at all, the apartments we lose them. And I spoke to my case manager, and she said that HUD has not increased any rents with the DCHA, like any kind of payment standard, for 3 years. And I really think there needs to be an adjustment made, especially with COVID. And now that COVID's over, I got to tell you, it's honestly frustrating when you're trying to find an apartment in that area to have to deal with DCHA, and it's really complicated.
Thank you. I'm over my time. Thank you, Councilmember Nadeau. Thank you, Kev.
Well, thank you very much to this panel and to my colleagues for your participation. Okay, so we are going to move to our government witnesses. We have a few in order to make sure we can cover all these topics. So we will now be joined by Director Laura Zeilinger of the Department of Human Services, Jenna Savasco, Chief of Staff at the District of Columbia Housing Authority, and Carissa Spann, Deputy Director of the Housing Choice Voucher Program at the Housing Authority. So we will get everybody up, and we will move the rest down. One second while we do some of that so that we can focus on you three. All right, so I'm going to administer the oath. If you could raise your right hand, all three of you, do you swear or affirm under penalty of perjury that the testimony you are about to give to the Committee on Human Services is the truth, the whole truth, and nothing but the truth?
I do.
Director Zeilinger, will begin with you when you're ready.
Okay, thank you. Good morning, Chairperson Nadeau, members of the committee, staff, and members of the community, and other council members who have joined us today. I'm Laura Green Zeilinger, Director of the Department of Human Services for the District of Columbia. DHS and the community organizations who provide supportive services through the Permanent Supportive Housing Program work in partnership with the DC Housing Authority to assist eligible residents to exit homelessness with permanent supportive housing vouchers, targeted affordable housing vouchers, and emergency housing vouchers. The tenant-based vouchers allocated through the American Rescue Plan during the pandemic. I'm pleased to testify before you today with a status update on our efforts. DHS joins the members of the community in celebrating the tremendous opportunity for a historic number of people who have spent years experiencing homelessness to finally access the necessary services and assistance to regain housing. I am proud to serve in a community that embraces housing first, that recognizes that housing is a crucial need, and that it is from the stability and safety of housing that people thrive. As council is aware, DHS has absorbed extraordinary growth in voucher allotments every year since the launch of Homeward DC. In fiscal year 22, the district government doubled down on our commitment to ending chronic homelessness and funded 3,400 new vouchers dedicated to the homeless system. With 100% growth in our largest program, permanent supportive housing for individuals, this is the greatest single year increase we've experienced to date. To absorb and successfully program this level of resources, DHS needed to scale up, which we have. We have created a new permanent housing division dedicated to our voucher programs, hired more than 15 staff over the last year, and are now planning for a dedicated Medicaid administrative team for fiscal year 23, with more than half a dozen new staff. We are making great strides, but all of this work has still not been sufficient to keep up with the resources allotted. The entire system needs to scale up as well, inclusive of PSH providers, our partners at the DC Housing Authority, the number of housing providers who are offering quality housing for rent, as well as our coordinated assessment and housing placement or CAP operations. Concurrently, during fiscal year 22, after more than 5 years of deliberative and collaborative efforts, DHS and the Department of Healthcare Finance launched a new housing supportive services Medicaid benefit. This Medicaid authority allows the district to maximize federal dollars for PSH case management services, which up until now had been 100% locally funded. This will allow us to invest local funding in continued expansion of our housing programs. The effort to transition our business processes and systems to successfully bill Medicaid has not been a simple one, and we've heard some things about that today. To build this system, we have leveraged technical assistance support for this transition for DHS and our PSH providers from the Department of Healthcare Finance, as well as the Corporation for Supportive Housing, which is an organization with national experience supporting other jurisdictions in their transition to Medicaid services for PSH programs. This transition has required significant time and attention from DHS and our PSH providers, and we're still in transition. That transition is still ongoing. So when it comes to voucher utilization, there is a tension between doing it fast and doing it well. We are consistently trying to strike the balance, the right balance, as both are critical for a well-functioning system that honors both the client and the integrity of the program. We are committed to robust and effective client service delivery through the housing process, and most importantly, to support individuals and families as they're being settled in the community. DHS is committed to rising to this challenge, and while every day someone is experiencing homelessness is one too many, we have had meaningful success in fiscal year 22. All fiscal year 22 vouchers were matched to clients in fiscal year 22, most of which were matched before the end of the third quarter of the year. Approximately 80% of those matched vouchers have been assigned to a PSH or TH case manager. And notably, more than 1,100 people regained a home of their own through the targeted affordable housing and permanent supportive housing programs last year. Almost half of the housing subsidies that were leased up were through the emergency housing voucher program. DHS, the districts, emergency housing voucher utilization rate. These are the HUD-funded programs that I mentioned in the beginning of my testimony that were appropriated as part of the COVID relief efforts. Our utilization rate is at 70%, which is almost 20 percentage points higher than the national average. And it also positions the district to be eligible for additional funding when there's underspending or lower performance in other jurisdictions. And I am excited to share that 19 of our 22 PSH providers have enrolled as a Medicaid provider, and 6 providers submitted Medicaid claims for August or September. This is a huge milestone, and as I mentioned, many years in the making. Even still, we know that in all the work we're doing, there is most certainly more improvement needed. And we are committed to doing everything possible without sacrificing the integrity of the program to make sure everyone who has been matched to vouchers is in housing. So for FY22 vouchers, we expect that everyone will be in housing over the course of fiscal year 23. And to that end, we are taking many focused steps right now. First, we're building DHS capacity, again, by creating and building out our permanent housing division dedicated to our voucher programs, including new staff, planning for a Medicaid administrative team. We are supporting our PSH providers with the Medicaid transition by bringing on an external consultant to provide one-to-one Medicaid billing technical assistance to each provider and connecting providers directly with the Department of Healthcare Finance for additional technical assistance if they need it, as well as with their digital health technical assistance program. We're supporting our providers with hiring and retention, and we've heard some things about bonuses and incentive payments, and that's something that I'm happy to talk more about, but we're rolling those out in addition to additional financial assistance such as amenity and building fees, and continuing to add flexibility on staff hiring requirements as appropriate. We have been hosting bi-monthly voucher application clinics to expedite the application review and submission processes. We coordinate very closely with DCHA to raise up issues in real time and track progress and concerns carefully. We also have been facilitating a landlord advisory group that has more than 20 landlords who participate in our programs who are committed to improving the landlord and client experience, as well as we're preparing to launch the long-awaited central unit repository in early 2023, which will allow centralized unit searching for our clients and providers. And we are providing better transparency through the launch of a storyboard and a dashboard, which will be updated monthly with information on voucher utilization by program, average length of time to lease up by program. We can certainly break that down into the micro steps for people who are interested in that and publish that as well. And we also share the geographic spread of vouchers across the district, something that we receive a lot of requests for information about. While we believe these efforts will have a significant impact and help more residents to attain housing with vouchers in fiscal year 23, we acknowledge that there are elements that are outside our control that represent real risks to our progress. We are in a competitive housing market where it can be hard for our clients to find and secure desirable units, especially given the limited availability of accessible units. There is a labor shortage in human services, especially for case managers and case manager supervisors, which impacts our PSH providers, as well as our agency's ability to staff up quickly. For example, DHS was able to secure only 75% of the case management slots that we contracted for with providers in fiscal year 22. That left approximately 1,500 case management slots available and to assist PSH clients through the housing navigation phase needed to move into permanent housing. This case management deficit created for the first time ever a backlog of clients who had been matched to a voucher, but were not assigned to case management services. And we have approximately 800 clients who fall into this category. We nonetheless are not deterred by these challenges, and together with DCHA and members of the community, we are continually assessing innovative ways to help our residents start the housing navigation process and attain housing, even while they are awaiting a case manager assignment. Thank you for allowing me to provide an update on our implementation of the historic housing investments that were appropriated in fiscal year 22. There is a lot to be proud of, and as noted, we will rise to the challenges presented and ensure a timely and rewarding path to permanent housing for our residents. I am happy to answer questions following DCHA's testimony.
Great, thank you. Go ahead, Ms. Mann, you may begin when you're ready.
Good morning. Happy Thursday, Chairperson Nadeau, members and staff of the council, and members of the community. I'm Carissa Spann, the Deputy Director of the Housing Choice Voucher Program at the DC Housing Authority. I am joined today by Jenna Savasco, who is DCHA's Chief of Staff. Director Donald was unable to be here today because she is in board meetings. Thank you for the opportunity to provide testimony at today's public oversight hearing on the Department of Human Services implementation of historic housing investments. My testimony will address the agency's role in the processing of supporting DHS customers to access housing through the local rent supplement program, our implementation of recent changes in the law, and the steps the agency is taking to improve our business processes. Accessing housing through the local rent supplement program. Our HCV division has three primary responsibilities in the administration of the local rent supplement program. First is the eligibility determination, request for tenancy approval, and finally the inspections component. Local rent supplement program is designed to serve households at or below 30% of the area median income. So determined eligibility starts with verifying the income for all household members over the age of 18 and considering other family circumstances like being a full-time college student, family disabilities, and the number of children under the age of 18. After a household is determined eligible for the program, the head of household attends a briefing provided by DCHA and the vouchers issued. Participants then enter the housing search phase. While the housing search process is directed by the household, these head of households, they receive services offered through DHS service provider network, including housing search assistance. After a household selects their unit, DCHA is responsible for reviewing the landlord packet, which is also referred to as the request for tenancy approval or the RFTA. In this process, DCHA verifies the proof of ownership as well as management authorization. The proper owner provides a copy of their deed and staff verifies the deed with information from the Office of Tax and Revenue. DCHA will approve the contract rent based on the sub-market rents and the tenant's ability to afford the rent. After the RFTA is approved, HCVP oversees the inspection process for all units that are rented with vouchers. During the unit inspection, DCHA assesses the unit's compliance with housing quality standards, which are the HUD minimum quality standards for the tenant-based program. Once DCHA has verified that the unit meets all HQS standards, the household is allowed to sign their lease. Implementing changes to the law. While our day-to-day business remains the same this year, we also implemented several reforms to the local rent supplement program. Pursuant to the fiscal year 2022 Budget Support Act of 2021 and the Local Rent Supplement Program Eligibility Emergency Amendment Act of 2022, the agency has implemented a process to allow applicants to self-certify for certain eligibility factors when an applicant cannot easily obtain verification documents. DCHA issued updated guidance that allows applicants to self-certify their full legal name, photo identification, date of birth, social security number, relationship to the head of household, and income. Since the law was changed, about 30% of applicants are self-certifying one or more eligibility factors. In the summer, DCHA also implemented the provision in the Eligibility Amendment Act that prohibits the authority from inquiring about or considering for the purposes of eligibility, admission, or continued occupancy, and any information about immigration status, prior criminal arrests or convictions, or pending criminal matters. Business process improvements. Over the last several years, the mayor and the council have made historic investments in housing solutions for people experiencing homelessness and in fiscal year 2022. That included more than 2,600 new housing resources. DCHA has continued to play a critical role in the expansions without stopping to assess the capacity of the agency to be able to support the dramatic growth. With recognition that customer service is foundational to our mission and timely completion of applications and inspections is key to customer satisfaction, earlier this year, DCHA engaged Nan McKay, a consultant with expertise in public housing authorities, to assess our current business processes and identify areas of opportunity to reduce the length of time that applicants wait for our services. We received the results on Tuesday, and we are looking forward to those results driving much needed change. We are also taking more immediate steps to improve our business processes, partnering with the lab at DC to update our forms, co-locating staff from our local programs with DHS, exploring the purchase of software that will assist with scheduling inspections, and giving housing participants and landlords more visibility into the process, and working with DHCF to ensure that all eligibility team members have access to critical systems to process applications as quickly as possible. We know that we have a work to do to build back the trust of our customers, and we are committed to doing that work. In closing, we are proud to be a key partner in the district's plan to ensure that homelessness is rare, brief, and non-recurring. Thank you for the opportunity to testify today. I look forward to answering any questions you may have.
Thank you for your testimony. Our usual timer is back. So you'll see that up on the screens, colleagues, for 10-minute rounds of questions. And I will start us off. I want to begin by asking some questions about what we heard in testimony today. For starters, Director Zeilinger, we heard some testimony about the hurdles of bringing social workers on to help with this work. And some of that is over in the Department of Health. But for DHS's part, specifically, Lynn Amano had asked, do we need to require the type of license that we do right now, or can we change what we require for these positions?
Yeah, so we agree with a lot of the testimony, and I think it's important to break some of it down,
Sure.
Given what is in the jurisdiction of the social work board. So if somebody has a degree in social work, but is not yet sat or passed a licensing exam, the social work board doesn't allow them to work as a case manager without a license. They consider that practicing without a license. And we've really tried to negotiate with them to help them understand some of the differences as well as some of the implications of this. And so some of the testimony about the way that impacts operations on the ground, particularly given some of the concerns about the licensing exam that were voiced, that is one issue that is really, we completely agree. And we do not think that case managers need a license in order to do practice. And so or not practice, but in order to do the case management functions, that it's not therapy, it's distinct from therapy. And we're really clear about what that job entails in so far as why it shouldn't require a license. And we, again, support our providers. We do require that there be a licensed professional on staff who can supervise. And there are a number of ways that a provider can meet that, but we aren't requiring that most of the positions who are doing a lot of that service have a license, and that isn't not a requirement. our contracts or our program. And I think as some of folks testified today, we have really listened to providers about what they need, and we have made changes to what the qualifications are within reason for the case management positions, because we do understand that folks have a range of complex needs, and we want to be sure that the person they're counting on is well qualified and supported, whether it's through additional training that augments their degrees or otherwise, to be able to provide that care. And we will continue to work with our providers and iterate. You didn't ask me specifically about what we're doing around some of the plans we have around how we're bringing in people with expertise from lived experience. And I'm happy to talk about that now or later, but I think that also is a crucial issue for us. So we have been researching a number of ways in order to provide a certification program that builds on the expertise that people have of lived experiences of homelessness and in other areas of social services, and augmenting that experience with specific training that will address the qualifications and needs for them to be case managers, and so that they can finish that with a certification that would also allow them to have the qualifications to get hired by DHS or any of our providers for a case management position. So we are in a process of working with a number of stakeholders on putting together the curriculum and a process in order to do that. We think it's a really important way to both to honor the experience that people have, as well as to expand the workforce as we've expanded the programs that serve people in our community. So it's something we're really excited, and it builds on the great success we had with our peer support, our peer educator program, where we were hiring people within our programs during COVID to help spread them, good information, factual information about how to protect yourself from COVID, about vaccines, and also just being helpful supports of peers within programs.
So just to clarify, it is not a requirement of DHS that caseworkers be social workers.
Correct.
However, if somebody is a social worker, they cannot do the job unless they are licensed.
According to the social work board, yes.
Okay, so the issue is this backlog of licensing. So
and I'll say some states like New York do not require a license, even for somebody who has a social work degree. So I think
someone's trying to waive in.
It's fixable.
Yeah. Right. So like a reciprocity agreement. We'll deal with that over in the health committee. Did you understand what Lynn was saying specifically, though, about those who are required to have the license and the distinction between the LISW or the LICSW?
I believe that both are acceptable. Let me just double check that I have that I'm accurate in that. Because
and this would be for the supervisor that we talked about.
So they just have to have someone on staff. It doesn't even necessarily have to be the supervisor, but there needs to be somebody on the team who is participating in the work, who's able to support, it does have a license.
Got it.
And so that can be a LGSW or an LICSW.
Okay, I think the request was that an LISW also be allowed, and I would ask that if you could just take a look at that.
Yeah, and I think that may have something to do with our Medicaid authority, and we're working with healthcare finance on that specific issue.
Okay, so just to clarify, somebody needs to have that license. It does not have to be a supervisor, so it could be a peer, as long as it's a member of that team.
Yeah,
any of the work,
and that is not it. The LISW is not a request that has been made to us. they've made it for an LGPC.
Okay.
So, but we will look into it.
Okay. Cool. You talked in your testimony about bonuses and you talked about the payment structure related to Medicaid reimbursement. The specific ask we heard in testimony was to go back to the place where we were with EHV, where payments were based on salaries of staff hired to do the work versus human care agreements. Can you talk about whether that's feasible or we could do something more robust?
It's not under the Medicaid authority. So we issued new solicitation. Contractors and organizations applied understanding what would be required and we will continue to work with them so that we want them to get paid for the work, but we can't just pay them on a cost reimbursement basis under the Medicaid authority that we are shifting under to.
What is going on with reimbursements?
And I also want to note though that we did a lot of work on rate setting and the rates are higher than they were under the old human care agreements.
Okay.
And I'm sorry, what is going on
with reimbursements and also the bonuses?
So with reimbursements, our understanding is that healthcare finance had to get all of the vendors in their system in order to make payments, and they've addressed that. But it took more time. It took a little bit of time on the front end. I'll make sure that's accurate. And I don't expect it to be an ongoing issue. It's a startup issue with the conversion to Medicaid. And in terms of the bonuses, it took longer than we expected for some providers to transition from their old contracts to achieve the certification to be able to bill Medicaid. And we wanted them to continue to be able to bill and people to continue to get services during that protracted timeline. So we had to augment their agreements in order to be sure that they were covered during that time frame. And in order to do that and not under the ceilings in our contracts law without coming back to council, because we didn't have enough time to bring those contracts back, we had to pull back some of those additional payments temporarily until we could get over to the new contracts. And we do expect to reinstate those, but we didn't want to have retroactive contracts or contracts over the allowable ceilings.
Okay, we appreciate that from a process standpoint. And now I am hearing also what impact that can have on our nonprofit partners. So we should just keep thinking through which is more preferable.
Yeah, it was, nobody knew how long it was going to take, right?
Yeah.
We estimated based on other jurisdictions on the technical assistance we had secured what that transition was going to be, but everyone's doing this for the first time, and it's
right.
And we're learning as we go. So it's, we're trying to do everything within our capacity, and we are in full agreement with supporting providers with hiring and retention bonuses. And we began to roll that out, and there's just sometimes trade-offs in terms of the rules we operate under.
Okay. All right. My time is more than up. I'm just gonna say Robert's name and see if he appears. Robert Wright, we'll have the first round if he is available. I know he's going between meetings. All right, and in that case, we will move on to Ward 2 Councilmember Brooke Pinto, followed by at-large Councilmember Christina Henderson.
Great, thank you so much, Chairwoman Nadeau, and hi, Director Zeilinger. Thank you for being here in your testimony. I want to pick up with a discussion you were just having about the hiring bonuses. So I hear you in that it didn't carry out as expected, but what is the plan to get those funds out the door, particularly as we are trying to scale up the implementation of more vouchers that will be coming available in a couple of months?
So now at this point, most of our providers are certified to be able to bill for Medicaid. And under their new contracts, it is my understanding that we will be able to help them with those hiring bonuses as well as their retention bonuses. But during the in-between time of operating under their prior contracts that we were extending until they could make that conversion, we were not able to do that without causing a retro package or a tipping action or some other administrative violation or something that was against our procurement rules around going over contract ceilings of a certain amount. So now we're in a position to be able to do that again, but we temporarily had to put those on hold because providers needed more time to be able to meet the qualifications to bill Medicaid. And we had to make a trade-off.
Okay, but what is the timeline for that being rectified?
They can do it now. I mean, any provider, oh, I'm sorry, December. So soon. I thought they could do it now. Not they're there, but by December, they will be able to do it.
By the beginning of December.
Yes.
Okay. Okay, great. So back to the timeline of trying to figure out where some of the outstanding sources of delays are. And the most recent information that I have from you all is that it takes an average of 158 days for an applicant from the start when they start working with the case manager to lease up, including 75 days between application approval and lease up. Is that timeline still accurate?
So we've published the timelines on our storyboard, and because they do vary from program to program. And so there's so I think that I would just ask that the committee and the public continue to refer back to that storyboard for the various timelines. But it's because it also has it differs based on the month somebody was referred in. People now that we're catching up and more people who've been assigned to vouchers now have case managers and before we had as long of a delay, that was faster. So it is speeding up, but there's a differential between depending on when clients were matched.
Okay, and the dashboard or the storyboard is certainly something we refer to very often and follow closely. But in terms of trying to determine which piece of the stage needs additional support or a change in strategy, when we think of the first piece with an applicant getting referred to a case manager, that tends to be on average 2 to 3 months, it looks like. Why does that process taking so long? Is that still a staffing issue, or are there other reasons for that delay?
So that's been an issue around the difference between the availability of the capacity of our case management providers to take on clients under their contracts and the number of vouchers that we have.
Okay, so the case management can't begin until there's a voucher available?
No, the case management can't begin until we have a case management entity who has the capacity to serve that client.
Okay, and when we think about capacity, is that again a staffing issue?
For our providers, yes. For all of us, it is. I mean, but yes, it's a staffing issue. But I wanted to be clear that it's not strictly a DHS staffing issue. It is exactly the things that we talked about the qualifications and various ways that are important in helping providers. It's some of the testimony about the salary levels that we heard. So yes, it is a staffing issue. They have to have the staff to provide the services. And if they don't have people who can provide the services, we cannot make a referral. So we had to do the conflict-free assessment, and then a client has choice among providers who have available slots, and they choose the case management provider they want to work with, and we make an assignment immediately from that. But we can only make an assignment where there is somebody, a provider who can provide those services.
Okay, and I know I'll speak to DCHA a little bit later about this, but in terms of when a applicant is approved and there is a unit available, from your perspective, why do you think that period is so long to get through the inspection process to get somebody placed into a unit?
This is probably a DCHA question where they would be best equipped to kind of break down the process around from the time a voucher application is submitted to the steps, the inspection steps.
And I will speak to them about that, but while we have you here, I'm just curious.
I'm not going anywhere, but I'm here for the duration.
Okay, well, while I'm here, I would just like to know from your perspective why you think that process is taking so long and what some of those barriers are. One of the pieces I'll just say that I'm concerned about is around virtual inspections that I think were a good idea during COVID to try to speed up the process. But I continue to hear from folks who, are having a really hard time scheduling a virtual inspection, or if somebody is carrying around their phone or computer, it's very hard to tell if there is mold or hot water that's running. And so I'm wondering if now that we're out of this kind of COVID-like environment, that we should return to in-person inspections. And again, I will speak to DCHA about it, but because you work with this population every day, I'm curious what your perspective is on that timeline.
So the virtual inspections are a different issue than I think the timeline, and because we intentionally have a shared panel, and I wouldn't want DCHA to try to speak to DHS's operations. I'm going to just ask Jenna or Carissa if you want to chime in to speak specifically around the delays. Councilmember Pinto, it doesn't help me to guess around where the bottlenecks, why DCHA, different things take a different amount of time within their operations. You've got them right here on the panel with me to answer those questions.
Okay, well, perhaps I'll, and sorry, Jenna, thank you so much for being here. I'll definitely turn to you maybe next round to talk about DCHA issues. But Director Zeiler, maybe I'll rephrase this. As we look at the timeline that is problematic for many applicants who are waiting, as you know, and I know you're working hard on this, what are additional barriers that we can remove to speed up the timeline? We've talked about staffing, we've talked about hiring bonuses, but from your perspective, as we're trying to move people through this process and get them leased up more quickly because we have all of these vouchers available, what's the next step to improve the speed and the efficacy of the program?
Yeah, no, so I am fully in agreement with you, the witnesses who testified, and everyone, that we want this process to go as smoothly and as quickly as possible. We need to, and also that we want people to have qualified professionals working with them, particularly not just in the lease-up process, but it's the same case manager who's going to be making sure they're okay when they're living in community. And we hear about when people don't get the kind of level of services that they need, that we hear a lot of things from neighbors, and nobody wants to see folks who need permanent supportive housing going in and not getting services that they need. So it is the entire, as I said in my testimony, it is the entire system that has to scale up. So DHS providers need to be able to staff and support so that there's no delay from the time someone's assigned at CAP to the time they can begin their voucher process and they have a case manager working with them. That's thing one. Thing two is that once they have a complete application for the housing authority that's reviewed and vetted by DHS, so that we're giving them good packets to work from, the time they need to be able to turn those around within 30 days or less. And it's taken longer than that lately. people then at the same time, if it is taking the right amount of time, they can begin their housing search. And we need to make sure that that people can access without discrimination the kind of housing that they want to live in the neighborhoods where they want to live. And that's an all of community effort. And we need landlords to submit the packets and their units to pass inspection. And I agree they can be physical.
I'm going to cut you off right there because I know I'm out of time. Councilmember Nadeau, can I just ask one more quick follow-up? Because I don't feel that this round has been addressing what I'm kind of trying to get at. Thank you. Just Director Zeilinger, I appreciate all of that. And I feel like we've talked about this in a number of different meetings and hearings about the process and some of what is currently going on and some of the hurdles. But I'm just trying to understand, what is the plan to scale it up? When you say we need to do this faster, what is the plan to implement those changes?
So it's not a short answer. And I did speak to some of those things in my testimony, and I certainly can give you some of the highlights. So one is where people are hiring, and as our providers are making this transition to Medicaid, we expect that there's only so many things a business or an organization can do at once, that we're going to see improvement and we're going to see expansion in those contracts. We knew that trying to double the PSH individuals program in 1 year, while also shifting the entire business model for our providers and the way they bill, was going to be a tall hurdle. We still house just as many people as we housed in fiscal year 21 while that was happening. And we are ahead of the rest of the country in using our EHV vouchers. And we have urgency and focus on making sure everyone who has a housing subsidy funded can exit homelessness with housing. So I don't think that I can have, like, my plan is to get those hiring bonuses out in December, in agreement with the law and our procurement rules, to launch a case management institute that helps people with lived experience meet the qualifications to be case managers and grow our workforce and those opportunities so that we have more service providers. We are working collaboratively with DCHA, and they talked about a business process redesign contract that they did where they received the report earlier this week, and we will jointly take steps to continue to streamline that process with them. And we will continue to iterate and do whatever is needed to get the timeline down, and we'll be transparent with the community and continue to publish the data as we did on the storyboard that we launched this week.
Thank you, Director. Thank you, Charlene.
Okay, so we're going back to Councilmember White, who has joined us, and then we will go to Councilmember Henderson.
Thanks so much, Chairperson Nadeau. I apologize. I was mid-sentence as you were calling me before. Director Zeilinger, do you know how many PSH case managers each provider has on staff today?
I'm sure our contracts team does. I couldn't tell you how many they have today.
But the agency knows.
Yeah, the agency knows.
Okay. What's the average case manager to client ratio? For PSH, it is, I will tell you in 1 second. I think it's there's a range, and I believe it's 1 to 25. Okay.
Sorry. Okay, wait. I've got it here. Sorry. It's 1 to 17 for individuals with a maximum of 25. So they're serving between, a case manager is serving between 17 and 25 people. For families, it's between 1 and 12 and 1 and 17. Okay. Both of those seem like a lot. Is the goal to reduce that? And what should be, do you think? So that range is there for a reason, because people's needs change over time, and it comes from what we know from our providers, as well as what we've looked at in other jurisdictions and the rate study we did when we converted to the Medicaid contract. So I feel those are good. That ratio is actually a very solid ratio. I have not heard that that is an insufficient case manager to client ratio. And it is, again, rooted in the recommendation from our providers, but we're not going over that. And that's why you're hearing about this deficit between available case managers and people who qualify for and can be and are assigned to a voucher for permanent supportive housing. That we've got to be sure that the services are there and we're not just overwhelming caseloads in order to move forward.
All right, so a case, a PSH case manager who has 25 individuals, you think that's not too much for them?
That is the cap, and it really depends, because in theory it's not, and our providers have told us that 17, again, it's a range, so it's between 17 and 25. And once people have been in housing for a few years, council member, they're sometimes all they require some pretty brief check-ins, but sometimes things go on where more intense services are needed, and so this allows case managers to put attention where needed, and it puts it gives the flexibility to our providers to look at and assign those caseloads based on what they see as the needs that the clients on their caseload have.
Okay. A recent job posting for a PSH case manager position in DC listed the starting salary as $50,000 to $55,000. What's the minimum, maximum, and average salaries for PSH case managers?
I don't know that number.
Do you know what DHS and providers rely on when setting case manager salaries?
So we did a rate study when we set the rates, but then the providers then determine what are the salaries they pay within those rates. And we did increase our rates substantially under our Medicaid contracts. Though I would not argue that they don't deserve more. I would like to see case managers make more money than what you just than what you saw advertised. But we don't set the salaries, we set the reimbursement rates through a process.
I have to imagine that if the providers had the ability to pay more, they would. So you're pointing to the providers as setting the salaries, but my guess is that they would probably point to the agency and say that there's something limiting what they can pay.
So we took their costs into account, and when we worked with an entity to do the rate study. And so the salaries they pay and detailed discussion with the providers went into that rate setting. Now, that was not yesterday, and there is some cost of living that goes into that, but we've seen record inflation. And so we just launched this new benefit and these new contracts, and we will, and we are working to give hiring bonuses, retention bonuses. We have included a cost of living adjustment in the rate. And so I think it's, and the rate also, in addition to that, also has an annual 2.5% increase year over year. So, but if it's not enough, we will continue to hear from our providers, work with our providers and with the Department of Healthcare Finance around what it is we can do to make those adjustments. And so we're not, you don't hear me sitting here saying that we're overpaying people or $55,000 is enough and adequate. But we did follow a very clear and can't think of the right word, but a process that is used in order to set these rates consistently across Medicaid and the healthcare system. We didn't pull it out of a hat and we didn't try to lowball it.
Do the providers bid for these?
Yeah, they do. They put in an application, but our reimbursement rate and the methodology around that had to be improved by CMS as we converted to Medicaid billing for our contract. So it's a well-vetted methodology, and it's one that is approved by CMS. And yes, providers applied knowing what the rates
Okay. So
were,
I would
and
say
they're
this-
higher than they were before we moved to Medicaid.
I think though that two things can't be true at the same time, that the process works to set the salary rates and that the salaries are too low. So something about the process has to be re-examined, because there's something in that process that's leading to salaries that aren't sustainable. And if we're looking at a situation where we're having difficulty filling positions and keeping people there, my understanding is that one of the issues is the salary. So what am I missing here?
I think is that when you zoom out and look at hiring for positions across the city, that this is not a unique issue to case managers in the permanent supportive housing program, or to this specific Medicaid authority, that the challenges around hiring and retention and building a workforce, particularly in a field of where we're providing human care, and there's a lot of burnout, that there's that this is something that we're confronting society-wide. And there may have been a certain thinking around what had been paid, had worked, and was perfectly acceptable and working well before the pandemic, that right now people are making different choices around whether it's worth it to them. And we need to go back probably and make some adjustments, but it's not, now that what's different is we don't have variable rates based on how providers bill. It's one rate approved by the Centers for Medicaid and Medicare, CMS, at the Department of Health and Human Services under our Medicaid billing, and any redo around those rates above the cost of living and the 2.5% that is built in will need an additional process. It's not at the discretion of the agency.
I appreciate that. Let me, to not go over my time, just ask one more question for now. How many PSH vouchers does DHS have for FY23? And as of today, how many of those vouchers are matched with clients?
1 second while I get your number for 23. We have, but I can tell you that, okay. So we will, I need to find my chart with the number of vouchers. I know we have delayed doing the matches because we are still trying to assign people who were matched to a voucher that was funded in FY22 to case management. And we've seen some of the challenges when people are matched to a voucher and there are no services and anyone to work with them to begin to help them through that process. So we have delayed, we're pausing, and then we'll make the assignments as our providers are ramping up and people who are waiting still in fiscal year 22 who are assigned. So I don't believe we've begun to match the FY23 vouchers. And that was a decision we made based on the fact that we still have to deal with this backlog. The number of
Director, you're muted.
Sorry, you bumped my keyboard. And we'll be doing the matching in January.
Wait, the number is what? Yeah, you were muted the whole time.
I was? Oh, I'm so sorry. The new vouchers in fiscal year 23 are 1,673. That includes unit-based and tenant-based PSH for individuals, families, and youth.
Thank you. Hopefully I'll be able to join another round. Thank you, Director. Thank you, Chairperson.
Thank you. Councilmember Henderson.
Thank you. And good afternoon. Thank you all for your testimony. Director Zeiliger, I want to follow up on some of the data just so we can all kind of be clear in terms of where we are. And I appreciate the database or dashboard, whatever we're calling it, that website information that was helpful, sort of took out some of my questions. So my understanding that for FY22, there was 3,430 new vouchers. Is that what we believe?
Yes.
Okay. 1,119 have leased as of whatever the date this was last updated. So that's only 33%. Do we feel like this is representative of what we should expect, or this is representative of the fact that this was the first major increase and so we need to adjust systems?
I think there are two things happening, right? So one is that the scale of growth in 1 year was more than anyone had ever done. And it was happening at the time that we're, coming out of a pandemic. There's a labor shortage and we're transitioning to Medicaid. So we do think that we'll see an improvement factor as we were seeing year over year before things kind of got, there were a lot of these external factors. Right. And then there are some things that we don't control where the answer depends. It depends on what the housing market can absorb. And right. It depends. There are certain things about the hiring pool and people who are applying for it and doing this work that are outside of our control, even if we're able to work with our providers to increase salaries and increase the hiring and retention bonuses. Right. So I'm very optimistic that, as I said in my testimony, that we will rise to the occasion and we will see improvement year over year, but I don't think it's realistic to expect that we're going to more than double the size of the program in 1 year and everyone's going to be in housing. And I think I was clear in decisions were being made that wasn't going to, that we didn't see that as right.
We had conversations that talked about it. Some of these questions are to get these conversations on the record so that everybody hears. Can someone seek an apartment without a caseworker if they have been matched to a voucher?
They can, but they absolutely can, but they're not, unless they've been approved for the voucher, they can't put in and they're not going to have this, the voucher will not start. They may find an apartment, but not be able to do anything about it because the subsidy will not have kicked in and they will not have services around their lease up. And that's okay.
So I'm just trying to, it seems as though the casework piece is like the bottleneck-ish for one start of the process. And so I just want to dig in there.
Yeah.
Have we ever done case management in-house?
So we have for some specific programs, but what we are doing is we are assigning people to work with folks who we know are going to be very quickly able to be assigned to case managers to help them with their voucher applications while they're waiting for their service provider, so that the point they have a service provider that they hopefully have a voucher application that is in being approved, and then those next part, they're not waiting as long and they're not starting their voucher application process at the time. So we are trying some things out in order to help to have some creative solutions in the meantime to address some of those.
So from a terminology standpoint, just because you've been matched with a voucher doesn't mean that you've been approved?
No, because you still have to apply and DCHA has to determine you eligible.
Got it. Okay. So, all right. So let's going back to the website. Okay. So we have matched 100% of the vouchers from FY22. It says 1,570 number of voucher applications submitted. Should I take that as the number of applications that are still pending with DCHA?
Yes. Some are, if they're submitted, then they're pending or they're in that next process. And DCHA can talk a little bit about, because we share the data that goes into this is shared. And so if you want to,
Okay.
DHA wants to share the data definitions, I think that would be helpful. And
Yes.
that could be something we add to our storyboard as well.
Yes.
Yeah, I think the vast majority of the applications that have been submitted are approved, and I can pull up what those numbers look like. But so those people are leased up. If they're submitted and approved, they may have gone all the way to lease up.
Okay, but on this, I'm just for clarity, you have a column that says number of lease ups, and then you have a column that says number of applications submitted. So I am assuming that lease up, you're approved and you're good, but submitted means we haven't determined you good to go yet.
I'm pulling up the storyboard because we actually, I looked at it briefly yesterday evening, but I have not looked at it in detail.
Okay. Just trying to determine where we are. Because we're doing I feel like the data is kind of important in terms of doing what, how many people are still pending. All right, while you
I think DHS just confirmed that there are only approximately 400 applications that are still pending. And that matches what our data says.
Okay, so the website is already out of date. Great.
I don't think the website is out of date. I think that submitted applications reflects applications that have been submitted and approved, as well as applications that have been submitted and are in another phase of the process, if that makes sense. We can also send you a more detailed breakdown that includes the total available in FY22, the number leased, the number that have been determined eligible and are in the process of housing search, the number that are that eligibility is still pending with us, and then the number that we're waiting on referrals for.
Okay, that would be great. So what is the average time for DCHA to review an application right now?
So I can tell you what our projected timelines are. And
what was your timelines in FY22? That's what we're talking about.
So unfortunately, we do not have data to verify timelines. I can tell you what DHS estimates are our timelines for these things. And I can tell you that we're working on having a system where we can actually track the time that it takes from application submission to eligibility determination. I can tell you the other phases in the process.
I'm trying to toe lightly here because I know y'all are going through a lot. But are you saying that you don't have a system right now that tracks an application through the process?
We have a system that tracks the application through the process. We don't have a system that tells us the length of time it takes for the eligibility determination to happen.
Okay, so if I were to ask you all, what is the longest pending application in your system, you could pull that up.
We can pull that. We can pull that. We can pull a whole bunch of data sources. It doesn't come out automatically. So it would be a manual process, but I could tell you, I could pull the longest one for sure. And I could.
But you can't tell me what average we're talking about. Okay. I think that's a problem. I think we can all acknowledge that just from a customer service standpoint, because if you all have SLAs, which is what I think many of our agencies do, right? You don't even know if you're meeting them or not. But like I said, this is not a housing hearing, so I believe that as it is. How many vouchers are we going to have at FY23?
How many vouchers does DHS have allocated in FY23?
Yes.
And go ahead, I can let you answer.
That's okay. I answered that in the last question. It's 1,673. Or in the last round, I think.
New ones. That's new. Okay. Okay. Apologies if I missed that. I have some other questions, but I'm not even gonna try in 30 seconds. So I'll just give back that time. Councilmember Nadeau.
So I, council member, have a whole series of questions about the number of vouchers that are in each bucket at this moment and how long they've been there. So I will probably get to that this round, and then you may be able to do more qualitative stuff if you want. Let me just ask a couple before I get to that. I was asked a question about DHS, the 2-day software training. It sounds like we have some provider staff being held up from starting work because they are waiting on that. Are you familiar with any backlogs there?
Today was the first I had heard about that. So we're with the provider to make sure that whatever training is needed happens.
Okay, great. It sounds like it's 15 staff who haven't received the training yet, and they've been waiting approximately 3 months. So it sounds like there's some sort of snag there.
Yeah, I mean, we've offered trainings. We've invited all of our providers to them. That isn't consistent with what we're showing, but we'll address it directly and make sure that we're clear and on the same page.
Okay, I appreciate that. I just want to go back to my testimony questions really quick, make sure I got everything. I know other council members asked about these things as well. Okay. How are you documenting client contacts like phone calls, visits, et cetera, under the new Medicaid contracts?
So providers document those in their database.
And you get a report of that, or you have access to it?
We have access to it, and then they also put it in their they document it in our HTH database, which we can see, and we generate a report to verify on all of the contacts.
Okay. Let's jump into my prepared questions. So I'm going to direct my first round of questions to everyone, then several questions to Director Zeilinger, and then some more to the Housing Authority. So feel free, folks, to jump in as you feel so moved. So I want to start by walking through each step in the process of leveraging a voucher to get someone into an apartment. Can both DHS and DCHA share in detail what process looks like for each of you and how it might differ across different kinds of local vouchers?
Sure. Jenna, go ahead. Do you want to start?
I think Chris is going to start us.
Great.
Yeah, so I will start on this one. I'll cover this in a testimony, but our process is the same essentially for all of our programs. So we don't differentiate. The process is the same from eligibility to inspection and the lease up process. So there are no differences between the programs.
And what is that process?
So again, with the on the eligibility part, once we receive the RFTA, or after the household is determined eligible
Let's
for
try
the
not
program.
to use any acronyms so that everyone knows what we're talking about too.
Okay.
Thanks.
So after a family has been determined eligible for the program, that head of household attends a briefing, which is provided by us, and they are issued a voucher. After that, they are allowed to enter the housing search phase, which is where they're looking for housing stock units that are available that meet the program criteria. And so while these housing searches are in place, they're receiving services from DHS. So when the units are selected by the families, after the household provides their request for tenancy approval, we will verify proof of ownership. We'll verify if there's a management company in place. We'll get information from the owners, record the recorder of deed, their deed document that is verified and matched through DC's Office of Tax and Revenue. And at that point, DC Housing Authority moves to determine whether or not we're going to approve the rent based off of the sub-market rents, as well as the tenant's ability to afford the rent. And so once the request for tenancy approval package has been approved, DCHA, we then move on to the inspection process, making sure that all the rental units meet the housing quality standard process, because that's the minimum standard requirement for HUD. Once that process is completed, the unit, the apartment, the rental property passes inspection, the family is now allowed to sign their lease. And so that process is the same for all the programs.
And I can pick up, I'm gonna, if it's okay with you, council member, just share a visual so that I think it helps to walk through the process flow. So through the CAP system, residents are matched according to the criteria that our community has developed and agreed on in order to prioritize people for permanent supportive housing. Once they're selected through the CAP process, we do an intake and assessment. That is the conflict-free assessment that's required through the Medicaid program. And that shows that the person is qualified to receive the housing supportive services through Medicaid, and then they're able to choose a case management provider. That provider then works with them to submit their housing application that comes through DHS so that we can try to do some quality assurance and support them if there's anything missing from that application. And we heard about the DCHA process. Once that's submitted, the case manager can then begin to gather information on unit preference, connect to a navigator if they need the resident needs assistance in their housing search. And sometimes we have units that we have been volunteer tested by landlords and that are already have passed some of the inspection, and we can also let them know about those units. Once they're determined eligible and receive their voucher through DCHA, which Ms. Spin just spoke about, they identify a unit. That unit needs to pass inspection, and can be re-inspected if needed. There's the other packet that DCHA spoke about. And then once the person's approved, they've selected their unit has met all of the criteria required through the voucher program, then we can do the lease up. That voucher briefing can happen ahead at the time of eligibility, or at times we've done it concurrently at lease up so that people to save time. And that's what's shown on this process overview.
So the briefing doesn't hold up the next step of the process.
It shouldn't. And those are also offered virtually, so they're very accessible. There is important information there that sometimes is helpful to do, is helpful to guide that housing search.
What does the Housing Authority need from DHS and from providers and from the council to fulfill its role in this process of getting people housed quickly as possible? And then I'm going to ask vice versa.
I'm sorry, did you say what does
the Housing Authority need from DHS and providers and from the council to fulfill this role?
Our teams work closely with DHS every day. One of the challenges that we continue to work through together is helping providers and applicants to submit completed applications for eligibility So we're able to process them quickly. We know that DHS works with their providers to train in this area. And we are considering how we can simplify our applications to be an easier process for our customers to complete. Aside from that, there is not anything specific we need from DHS providers or the council today.
Does the self-attestation help address that issue? Or there's still other aspects of the application that can be held up, Ms. Span? I'm
sorry, can you repeat that?
Does the self-attestation help with this issue that you identified here with the incomplete applications, or are there other aspects that are being held up?
No, I think that will tremendously help the process.
Okay. Director Zeilinger?
I think we heard just more attention on applications once they're submitted, so that they're not, so that they are timely approved, or if something is missing and we didn't catch, that we're able to rectify it quickly without it sitting for a long time. So, and just more visibility and attention on that. And I know that that's something that DCHA is already committed to doing. And just we're really excited to work with DCHA based on the process improvement work that they funded in order to really put everything back on the table. Historically, when the program was much smaller, we had a lot of parallel processes that made our assignment to lease up much faster. And I think that we have the ability to think creatively and return to a place where this is a really efficient, effective process for people. So I think just, the ability to think creatively, work creatively together is something that we all need to do, and we're all committed to.
Thank you both. So I got through 3 questions in that round. We have many more. Let's see what colleagues are still with us. Robert White, you may go ahead.
Thank you so much, and thank you again, Director. A recent Street Sense media article in DC Line article outlined DCHA's 3-part process for determining the maximum value of a voucher. The article said that first, DCHA uses federal fair market rent prices to determine the maximum value for a voucher across the entire city. Second, DCHA caps vouchers at a certain rental amount depending on the neighborhood. So a 1-bedroom voucher without utilities is worth $1,400 in Anacostia, but $2,600 in Capitol Hill. Third, DCHA determines a fair rent or rent reasonableness for a particular unit, so the rent for a voucher holder is in line with the rents for other renters in comparable units in that building or neighborhood. Is that an accurate description of how DCHA determines the maximum worth of its vouchers?
So yes, we do use fair market rent. For our submarkets, we have an approved rent for each submarket. So as stated, from one community, Anacostia versus another community, the rents may look a little different, but we do make sure that the rents are affordable for the families who are participating in the program, which is a requirement.
Okay, so in that second step, capping vouchers at a certain rental amount depending on the neighborhood, what's DHS's role in determining that step?
DHS doesn't play a role in determining that step.
Okay. What about step 3, determining fair rent or rent reasonableness for a particular unit, so the rent for a voucher holder is in line with the rents of other tenants in the comparable buildings? Does DHS play a role in that?
No, DHS does not play a role in that.
Okay. Let me turn to another issue. Well, actually, before I do that, let me let me go to another question. So DMPED is not currently a member of the Interagency Council on Homelessness, or ICH. Do you think that including DMPED and ICH meetings could create more alignment among the district economic development policies and the mayor's goal to make homelessness rare, brief, and non-reoccurring?
So we have a housing solutions work group through the Interagency Council on Homelessness, and that housing agencies actively participate. And when there are issues where they intersect with DMPED, we have brought them in and we have worked with them as a willing partner. I have not experienced sort of we understand that they, in the Office of Planning's goals around, in our comprehensive plan around affordable housing, they took a lot of time to look at the intersection between that and Homeward DC. And so I don't see a problem that needs to be solved by having them required at the ICH. I know they would come if invited and asked as needed. There's always an advantage around collaboration, but that collaboration is happening without their official membership.
Okay. Let me go back to very briefly a discussion we were having earlier about salaries. I think that part of DHS's recruitment and retention strategy is to roll out bonuses and incentive payments. How do those bonuses and incentive payments work? And does DHS pay them separately in addition to the rates?
So providers pay them to their staff, and they would be able to bill us for a hiring bonus and a retention bonus. The retention bonus, I believe, is at a year.
Mm-hmm.
I can double check that for you.
Okay. And if providers wanted to pay their caseworkers more, that would probably increase the amount of their bid, and I guess theoretically make it less likely they would win the contract.
The rates are fixed.
Okay.
The rates are fixed. They're the same for every provider under this new Medicaid authority. And so they can pay, and it's regulated in law. And so they can pay whatever they pay within those rates, but we would have to, so I'll just leave it at that.
Okay. Then where does the variation in bids come?
There is no variation. They all get the same rate. Now they may pay what they do with that rate and how they run their organization and who gets paid what.
I see.
That's something that is.
Okay. Okay. Let me ask just one other issue. I learned recently that the National Park Service plans to move people in encampments at McPherson Square by April of 2023. What steps is DHS taking to prepare for the encampment removal?
So the Deputy Mayor for Health and Human Services takes the lead on all things encampment, including a response to something like that. So we work in collaboration with them and our outreach teams to ensure that we, as we do everywhere, that we know where people are, that we have a by name list, make sure that they have a housing assessment so that they're being considered for housing, and so they have good information about what resources are available to them and what is being planned by National Park Service. And so those are steps we always take. And those are steps that we take when the National Park Service is planning to take action related to an encampment on National Park Service land.
Okay. Does DHS expect residents at McPherson to receive vouchers?
It would, some probably have. I don't have that information with me right now, but some, if they meet the criteria for permanent supportive housing, then yes, they would. Of course, we would match them to the housing they're eligible for, them, which is what we always try to do. That's what it means to be a housing first system.
Thank you, Director Zeilinger, Deputy Director Span. Thank you so much, and Chairperson Nadeau. Thank you again.
Thank you. Councilmember Pinto.
Thank you so much. Deputy Director Span, I want to turn to you now as we think about and follow up on some of what you were talking about earlier with the self-certification for our vouchers. What were some of the hurdles to the last 18 months or so getting self-certification up and running? And now that it is going to start, how are you expecting that to affect our timeline of getting applicants placed in housing?
So now that we have a clear understanding of the new policy, we have implemented training for staff to allow self-certifications. I do have to check on if there has been a challenge since we've, implemented this new policy, but staff is aware of the changes and what's required. So we don't foresee any futuristic challenges allowing.
Chris, if I can just jump in.
Come through and stuff. Okay.
We implemented self-certification over the summer for all of the requirements with the exception of ID and project-based vouchers. So we've seen that about 30% since then of the applications are coming in using one form of self-certification or another. We yesterday were able to send guidance to DHS for identification and project-based vouchers, which they sent out to the provider community. So people can now also self-certify for those. I think we will have feedback soon about how that's going.
Okay, thank you. And based on the kind of numbers that you've already seen or the hurdles that folks have had with identification and project-based vouchers, is there an estimate you can provide on how you think that the new categories of self-certification will speed up the timeline or affect the timeline?
Yeah, I don't know that it will necessarily speed up the timeline. It may speed up the timeline on the front end for our eligibility determination. But even when customers, after that, customers still need to apply for a unit, and there is a process for the landlord to accept them through that process. That process usually would require an ID. And so while it may speed up eligibility on the front end, I don't know that we'll see that on the back end.
Okay, thank you. I want to follow up on our conversation that I was having before with Director Zeilinger, but with you all from DCHA about housing inspections and unit inspections. Is it true that the timeline is about 10 days by which an inspection is needed to be conducted within DCHA standards?
So after we receive an RFTA packet, that's the landlord packet that the landlord fills out and the tenant fills out and signs, and they submit to us. It takes, our target is 5 to 7 days to review that packet and approve it. And what we're seeing now is that that's taking about 7 days. After that happens, it takes our team 3 to 5 days to then schedule the inspection. So between those two steps, that is about 2 weeks. The timing of the inspection does sometimes vary depending on the availability of the landlord. And if it's an urgent request, we're able to get out there faster, but otherwise it is scheduled for a few days out.
Okay, and are the inspections being done, to what extent are they being done virtually versus in person? And if both, how are those determinations made as to which one is more appropriate?
We're still doing inspections virtually right now. We do have a plan to begin in-person inspections for certain type of inspections in the new year. So for QC inspections, complaint inspections, and ADA inspections, we're moving to in-person inspections in January.
Okay, and what's the thinking about waiting until January to start some of those in-person inspections?
I think in-person inspections requires more time and more staff time, and scheduling and coordination with landlords. So I think we're moving people around and giving staff notice that things are changing.
Okay, and what is the current process for getting those inspections scheduled? Is there a centralized office or database that helps with a lot of those logistics? Do you have a separate inspection team? How many people are on that team? How does that work?
Yeah, we have an inspections team. I don't know the exact number of people that are on the inspections team. Chris, if you do know, feel free to jump in. They pull the inspections out of our landlord portal to schedule them after the packet is submitted. Carissa spoke a little bit about this in her testimony, but one of the things that we're looking to do is expand the functionality of our software to allow more visibility. Right now, landlords can see when their inspection is scheduled in our system, but we're hoping to also be able to add participants to that system.
Deputy Director, do you have anything to add to that piece? I know you came off mute.
No, I do not. Thank you.
Okay. Okay. I just want to share with you all some of the feedback that I've gotten from some landlords about the inspections, some of which come from newer buildings and have highlighted some of the challenges in getting those inspections scheduled on a timely basis, and have expressed kind of frustration that even though they would have expected that the units that are going to recipients who are voucher holders may have been leased up more quickly, that the vacancy rate in those units kind of set aside are higher than their other kind of market rate units, which I thought was just interesting piece of data and a good reminder of kind of getting mobilized on some of this. And the other concern that it sounds like some of this will be addressed in January with the move to having some inspections in person is that, of course, it is hard to tell over the phone or over video if there's mold present or if hot water works. And so I'm not sure how that's currently working in the virtual inspection model, and what your thoughts are on moving to a fully in-person model. I feel like it sounds counterintuitive because I would imagine, and I thought this 2 years ago, that it might speed things up to do things virtually. But at least in some of the anecdotes I've heard, it doesn't sound that that's the case. I'm just curious what you're thinking about as you look at post-January environment.
We haven't really explored a return to in-person inspections for all of the units, but I do, I hear what you're saying. I think there is value in both approaches, or pros and cons in both approaches. And so, we can consider that moving forward.
Okay, thank you. And so in our final minute, back to our permanent supportive housing vouchers. So there are 2,400 new vouchers. How many new staff were hired at DCHA to administer these additional vouchers?
I don't think we have that number today. I don't know the answer to that question.
Okay. If we can find that, that would be helpful to know. I guess I can reframe it as what types of strategies have you been or are you going to be employing to mobilize those vouchers more quickly?
I think Carissa spoke a bit to that in her testimony, but I think there's been a lot of staffing changes at DCHA including in the HCBP program specifically over the last year. And so, I think we're looking for some stability in our staffing, but also to backfill some of the positions that are currently vacant, so we know that we can fulfill the need. We are also talking with the lab about getting their help to simplify all of the forms for each step in the process, so that they're easier for customers to use, so that when we get applications and RFTA packets, they're fully complete. Sometimes going back and forth is what takes a lot of time. We also have some staff currently that does not have access to critical systems to be able to check income for customers. And so we're working with healthcare finance to get staff that access. So we're taking a lot of steps. We also will be implementing some of the recommendations in the Nan McKay study. So we're focused on this.
Great. Well, thank you so much. Those are a lot of good steps, it sound like. And I want to thank all of you for your effort. And just to reiterate, we are all on the same team here. I know everybody's shared goal is to have these vouchers be utilized effectively and smoothly and quickly. And so I thank you all for the big effort here. And let's just keep working together. If there are hurdles that are identified and you need additional support, whether that's infrastructure support or funding or staffing, let's all keep oaring in the same direction, and not, hopefully we'll be able to have an even better update next time we do this. So thank you all.
Thanks. I want you to know that we do share that goal, and it is important to us to make sure we're using the vouchers quickly.
Thank you, Councilmember. Councilmember Henderson.
Thank you. Ms. Savesco, I want to give you a little bit of time to clean up something that you just said, just in case people jump on it. You mentioned that the staff didn't necessarily have the systems necessary for income verification.
Yeah, we have not everyone on our team has access to DCAS, and we're working to get that cleared up. So a number of people do, and so they're able to complete. We're able to complete income verifications using the number of people that have it, but not every member of our team has access right now.
How many is the number who have it?
I don't have the numbers right now.
Okay, I'm gonna let it ride. Is the application, Director Zeilinger, the application that goes to DCHA, is that online, or is it still a paper documentation system, or can someone upload documents and send it over?
I think we can, it's a paper application that people do, but I think we upload it. Oh, actually, no, I'm sorry. It is now electronic.
Okay, great. Let's talk a little bit about the amenity fees situation that came up in the panel with the public witnesses. I introduced legislation recently to try to limit the processing fees or the other fees outside of application fees that we are seeing landlords just sort of tack on to things, as sort of my offering to try to help with a solution here, because we know that there are limitations in terms of what a voucher can cover. But there was some testimony I think you heard where they said the CBOs have been covering some of these fees with the expectation of reimbursement, but reimbursement has not come. Can you speak to that?
No, we can reimburse that, and we thought that was clear, so we'll make sure that our providers know that.
Sorry.
We can reimburse amenity fees, and we'll make sure that that we clarify where there's any question.
Thank you. Sorry, the joys of working from home when you have a dog, and deliveries are coming. Okay. So in terms of barriers, though, and DCHA, you could help. You could also feel free to sort of respond. It seems as though that this is also a problem, right? That a person might have a voucher, but they may not have the funds to cover all the other extra things that are being tacked on. Thoughts on that? Anyone?
So with the additional amenity fees, it all has to be approved on the front end to make sure that the family could afford to pay the rent, right? So if it's the rent plus an exuberant trash fee or parking fee and all these extra fees, it still has to be approved in advance. And so this is a challenge, and this is a barrier that we have been working through and helping families to identify more affordable units. But unfortunately, we can't control if a developer or a housing provider is charging all tenants those fees.
To the extent, and to the extent where you all see pattern and practice that you believe is not necessarily like, oh, this is just the cost of doing business, but also it's getting to the point of, no, we believe that you are discriminating against someone with a voucher by your addition of all of these. Are we making the necessary referrals to the Office of the Attorney General when it comes to these particular landlords?
Now, this is not something that we can speak to, Jenna. To my knowledge, that's not something that, we handle on our level. So we don't get large complaints of housing discrimination just because the DC Housing Authority has no jurisdiction over that. So that would be another agency.
Right. You don't receive the complaints, but you would receive it anecdotally over the course of doing business. If someone is, and perhaps it's more the caseworkers that are hearing this.
Yeah.
But I think we need to
and we do make those referrals to the Attorney General. So it would be the caseworkers who are helping people with their applications.
Okay.
And if we saw any practices of discrimination, we would, we do, and when we do report those to OAG.
Okay. And the limitation in terms of the voucher only covering rent, does that include? Well, yeah. Is it only rent and that's it? I'm trying to think of the other line items that
sometimes utilities are included and sometimes they're not. It depends on the building.
Okay.
And if they're not included, we assist with them.
Okay. Okay.
And then the amenity fees you were talking about, or other fees, whatever they're called, then there's a cap, but that we can reimburse those. And there's an amount that we reimburse for for year one, an amount we would reimburse subsequently. So it's for year one, it's $1,000, and go after the first year, because sometimes there's other first year fees at move-in.
Right.
And then up to $500 beyond that. So we really try to not make that be a barrier, because they're more common in neighborhoods that our clients have traditionally not had access to, and we want to make sure that that isn't the reason they can't live where they want.
Got it. Okay. I want to ask about some of the vouchers that were set aside for special populations. Who in the continuum of DC government agencies tracks and manages those? For example, we have some vouchers set aside for veterans. We have some vouchers set aside for seniors. We have some vouchers set aside for LGBTQ and seniors. Who is managing and tracking those?
So we have a team at DHS at DCHA. I used to work at DHS, at DCHA that manages the special allocations. And they do not make the referrals for the special allocations. So in partnership with other agencies, we get those referrals. So for example, the senior referrals come from the Department of Aging and Community Living. The LGBTQ office makes the referrals for those vouchers. So we do have a team that manages the special local allocations.
Okay. I'm going to say this, and I know that I'm going to say this because I want everybody to hear this. I think it's really wild that these offices or smaller agencies get to control who comes in for those special population vouchers without much oversight, if you will. I feel like it's a real dangerous gray area for district government. And I feel like we need a bit more of a transparent process. And so if OPLA is listening, I believe there needs to be a more transparent process on that. Because the idea that, oh, if someone shows up at X community affairs office and spends enough time to make friends with the staff, now they get to be referred. Like, is there a formal application process? What's the deadline? How are you reviewing it? And how are those moving forward? I feel like that needs to be transparent and laid out. I'm not opposed to these vouchers. I think they are super important, but I am just real like this. It's a gray area ripe for abuse.
Yeah. So those allocations come through the budget process to us. We don't make the decision about how they come to us. I do know that obviously DHS has a system to prioritize them. And I know that the Department of Aging and Community Living also created their own system to prioritize them. But we don't manage the referral processes on the front end at DCHI.
More work on the oversight part for the council, which is not a problem.
For the housing committee, I will note.
Oh yeah. Oh, so not for you all.
Fine to talk about it here. I'm just saying it's not under our purview.
Right. Hold on one second. I lost my place when I kind of went off on that small tangent there. So Director, I mean, I sort of wrap up here. Director Zeilinger, like, what do you need from us? What do you need? How can we help you all and your team and the CBOs that you work with execute this better?
I think that I think someone might have been Councilmember Pinto acknowledged earlier. I think the finger pointing in it isn't as helpful as really understanding that we're all facing challenges and we need some latitude to creatively solve those problems, and that there are things that government can do and things that government has, are harder for government to do for exactly the kinds of issues around integrity, Councilmember Henderson, that you've highlighted. So the issue around licensing, and we are not able to, that is within the purview of the Board of Social Work. When I brought that up with the Dr. Nesbitt, when she was director at DC Health, she was like, that is for the Social Work Board. I don't make their rules. So it is something that I think that one thing that would help with that hiring, and it just continues to be an issue. And I think that's one thing that would be helpful for the council to take up. And I would love to consult with the range of stakeholders in DHS and in our partner organizations, and actually come back to you if there are additional things that I'm not thinking of off the top of my head.
Okay, thank you. Thank you, Councilmember Nadeau.
Thank you. Okay. So now I'm going to ask some questions that are going to seem repetitive, but the goal here is to get information on the record about the number of housing vouchers we have available. All right, Director Zeilinger, how many of the 395 permanent supportive housing for family vouchers funded in FY22 budget have been matched to clients?
All 395.
How many of those client households have been assigned to case management?
282. There are 113 waiting for case management slots. They are all in housing in the FRSP program.
Okay.
And we expect they'll be assigned within the next month or two.
How many of those 282, wait, hold on, nope. Sorry, going back to the main. How many of the client households have leased up?
So from FRSP into the voucher program, 121.
Okay. What is the average length of time between being matched and being assigned to case management? And the average length of time between being assigned to case management and getting leased up?
So from match to assignment, it's 46 days for families. And from assignment to lease up, it's 188 days. And I think it is important to note that these families are housed, and sometimes when they are able to move from FRSP onto a voucher, it's an opportunity for them to access a different neighborhood, or if they haven't been happy with the way their landlord has been handling the housing conditions and repairs, and they are taking the time they're allowed to take in order to identify a different unit. So not all of that is a government inefficiency. It's respecting people's rights and the time it takes for them to decide where they want to live.
And housed while they're doing it.
And they're housed while they're doing it, which is very different than what we see in the single side.
Speaking of, how many of the 1,924 permanent supportive housing for individual vouchers that are funded in the FY22 budget have been matched to clients?
All of them, all 1,924.
How many of those client households have been assigned to case management?
1,195, which leaves 729 waiting for a case manager.
How many of those client households have leased up?
276.
What is the average length of time between being matched and being assigned to case management, and the average length of time between being assigned to case management and getting leased up?
So for 821 of the clients, it's 69 days, but it's longer for clients who have been matched since July, because that's when we started to run into the limitation of the barrier on our case management slots. And for these clients, which 207 fall into that category, it is 152 days.
Tell me one more time, how many people, the average is 69 days and how many is 152?
For 821 clients, it was 61 days from match to a voucher to assignment of case manager.
Mm-hmm.
And for 207 clients, that number was 152 days.
Okay.
And then from that point of assignment to lease up,
Mm-hmm.
taking 187 days on average.
Which is about the same as for families.
Yeah.
Do you happen to know how many or what percentage of these residents are at PEPV or some other temporary housing?
I know that about a third of the clients who are at PEPV are assigned a voucher.
Okay.
So I could probably back into that number or follow up with where people move around. So
yeah.
Where at least this we're understanding folks to be.
Yeah, one of the things that I noted in the appendix of Jesse Rubin's testimony that he didn't get to give live, I think, was just a number of clients that they have who've been in PEPV but had difficulty following program rules and then have been back out on the street while waiting to be housed. So I think that's just one of those things that would be good to know sort of how often that happens.
Yeah. So, and I misspoke. It's closer to 47% of the clients in PEPV who are assigned to a voucher. And that, which is about 266 clients there where that is the case. And there are we also recognized, and we heard testimony today from Mr. Thomas about the fact that our rules were really hadn't been updated from earlier in the pandemic when things were closed and social distancing was we didn't have vaccines, was a way to keep people, the primary way to keep people safe from COVID. And so we have recently, we heard from residents, we have now updated those rules so that the culture of what it feels like there is, he described it as feeling like being in jail. We don't want that. It shouldn't be like that. We understand why we're getting that feedback. And we did hear that, met with residents, heard that, changed those rules, and are meeting individually with clients to help them understand what the expectations are while they're there so that it doesn't happen. But our goal is to work with them to get them, the folks who have a match to a housing resource, to help them get into housing where they can make all of their court, and as long as they're abiding by their lease terms, of course, where they can make all of their own rules, because we're not trying to balance the safety of the community, the operation of a program, trying to provide a range of services in a hotel. But both and needed to happen. And we really appreciate the advocacy to point out the areas where we needed to change.
Yeah, and I think this hearing helps with that too, so we can keep refining. How many of the 307 targeted affordable housing for families vouchers funded in the FY22 budget have been matched to clients?
All 307.
And how many of those client households have been assigned to case management?
270.
How many of those clients have leased up?
86. And again, these are families who are in a first payment.
Yeah. Okay. And what is the average length of time between being matched and being assigned to case management, and the average length of time between being assigned to case management and being leased up?
For the former, it's 153 days. And for the latter, it's 360 days. So this includes families that have been matched and assigned since fiscal year 20.
Okay, and this sort of runs parallel to various extensions we've had for FRSP.
It does, as well as we had to hire, the caseloads got too high at DHS, and we had some attrition here and had to hire TH. We are providing those direct services, and we had to hire to make sure that we were able to do the work on our end.
So some of these households didn't have case management during that time?
Well, that was the delay in assignment, because so that we could make sure people had case management.
Got it. But they were housed.
Yeah.
Through FRSP. Okay. Could you share how each of these voucher types differs from the others, the services attached to each, and what population each type serves?
So for permanent supportive housing, you're saying what are the different program types and what are the differences? For permanent supportive housing, and this includes the way we've used our emergency housing vouchers, where we've matched the services which were not funded with those vouchers, as well as the PSH vouchers where the district has funded both the vouchers and the services. So those are generally serving people who meet the definition of chronic homelessness, individuals and families. So they have a disabling condition, or they're at imminent risk of chronic homelessness, as well as they have a length of homelessness that is over a year, or repeated episodes of homelessness over a 3-year period. They also have an assessment that indicates that they would benefit from services to match with their housing subsidy in order to obtain and retain housing. And that's done through an assessment. The service component in the PSH, it has a smaller case manager to client ratio that we went over earlier in response to Councilmember Robert White's questioning. And there's a certain amount of contact and visits and checking in that is required from on the service provider side for the PSH program. So we're really looking at folks where there's a both and service coordination and affordability are the key factors in helping them exit their homelessness. Our Medicaid housing supportive service benefit mirrors that criteria around who's eligible for the services in the program. For targeted affordable housing, this serves individuals and families who also may have a disabling condition and are maybe at risk of chronic homelessness, but their assessment shows the intensity of services is not as great, and that but they do need the rental assistance. So they may be on a fixed income through SSDI, and the affordability is the main issue. And they may also be connected with other services in the community, and they don't require DHS case management, but a regular just check-in around their well-being. And so these have a much lower level of contact, a quarterly check-in by a case manager. And so that is the general criteria and around who the targeted affordable housing is serving.
Thank you. One thing that I noticed from the storyboard that went up yesterday was that the average time to lease up is going down for every type of voucher except for the emergency, the EHV.
That's because those are already leased up.
So they're done. Okay.
For the most part. I mean, so we've been really focused. And so if there's some issues with some people there, it may be just that there's some, it may have to do, we could probably look at what the individual circumstances are, but it may be that there's an availability of someone might need a unit that is in short supply, like an ADAG unit, or they have really specific requirements around where they want to live, and being able to secure a lease that meets their requirements is taking longer. But we've been able through the HV program to really, we started with those first, and that's also some of the delay in the locally funded lease ups that have been testified to and supported. And I want to use this as an opportunity to challenge the assumption that the only vouchers that count are the vouchers the district is funded through LRSP and not the HVs, because there's some selectiveness going on in what the denominator is in talking about what percentage of vouchers are leased up. And I think that had we not touched the HVs, this hearing would be about, why are you leaving HUD funds on the table and not housing people with that resource? Why have you not dedicated the necessary services? Why are you not doing what it takes to make sure that we're leveraging every federal dollar toward affordable housing that's needed? So I just encourage that in future reporting by the city, paper and street sense, and in the way we evaluate ourselves, if we care about using those vouchers, which I think we all do, they should count.
Yeah, I mean, I think we've been really hyper focused on this because it was a council action. And so I appreciate that point. So your point essentially is, if we hadn't had EHV, then we would have worked our way through this allotment. But because we had EHV, we started there because it was time limited. Yes. Yeah.
And there were
another point for the special purpose revenue fund, right?
Right. And we receive higher payments from HUD the faster we lease those up. And we passed those payment incentives onto our providers and our clients, so that if we were going to get more money by leasing those vouchers faster, it wasn't the district. It was, there was a share of that was also going to folks on the ground doing the work, including the people doing the work they need to get to make their way out of homelessness.
Yeah. And you've talked about this a bit, but lessons learned from that process. I mean, what's your top 5?
Well, I would love, I think it's together with DCHA, sure. But the flexibility that on some of the HUD requirements really, I think, helped us look at ways that we could do attestations and move more quickly. Then we are studying and looking at whether the incentives helped or didn't help in folks getting housed more quickly. There was definitely, because of those incentives and the focus from HUD, there was a really important leadership focus and attention on the allocation that I think also helped with removing bottlenecks and really staying focused on those. And our providers also, talked about that rather than a reimbursement rate, they were working with a rate based on, they were working on a grant for the salaries for that.
Does DCHA want to weigh in at all also on sort of what we've learned and what best practices you've been able to put in place following EHV?
I think we've had a lot of turnover since then, so I'm not sure we're the right people at this time to weigh in on that specific question. But I do think our Nan McKay report and some of the other work we're doing now will help us identify best practices and put them in place.
Okay. Thanks for that. Just want to, sorry, I'm looking through my questions, making sure we're not going to duplicate since we've been here a little while. And y'all have answered a lot of questions already. See, I just knocked 2 out for you right there. All right. So it also seems like there's a gap between the number of targeted affordable housing families assigned to case management and the number of families with a lease. Well, we kind of talked about this too. I think you said some of the discrepancies there are because of the caseloads having gotten so high. All right, yep, we've gotten that one. Do you have any data regarding how many people who've already been leased up using our vouchers have found themselves presenting at a shelter or experiencing homelessness?
I don't. We do track returns to homelessness as part of what we report. TCP reports to HUD, but around these specific allocations, we don't have that data. And we're and so but we think that we don't see any slippage that we're aware of in the housing retention we've experienced over time in our permanent supportive housing program. And I think that's really important to note, because I don't want the lack of a precise answer to sound as if people are returning to homelessness in large numbers and we don't have our eye on the ball.
Yeah.
That it, generally speaking, our program has had over a 95, really closer to a 98% retention rate. And we're really proud of that. And it's something we're committed to sustaining. And it's partly why we're not, we know how important the services are to that and why it's important that we are deliberate and don't sacrifice quality for speed.
You just reminded me that I had another question from earlier. When you had the chart up that showed the flow, I noticed there was one purple box that was TCP, which is the matching resident to voucher. So TCP is involved at the front end of the voucher process?
So they co-chair the CAP process.
Got it.
Because it's out of we use HMIS and we use, so no matter where the touch point is and someone has a housing assessment, it's all centralized. So, and I think I know we're not trying to, take too long in this conversation, but I think Councilmember
new topics are okay, just not repeat.
Councilmember Henderson's point about there being transparency in the way I think people are prioritized, that it not being who you know.
Yeah.
That's important. And I think we can always look at that and look at how people have advocacy in the system based on who their case manager is or who their outreach worker is. But there is some in the CAP process, there's some ability to correct for that and make sure that we are noticing when there's bias and evening things out. So the criteria is set through a collaborative process with the community and the ICH. TCP is looking at the data on to verify lengths of homelessness and as well as the housing assessments in the system. And we co-chair the CAP process based on for families, youth, single adults with them. And so that's a really crucial role they play as our COC lead, one of the many crucial roles they play.
That makes sense. I just kind of forgot that they were there at that role because we've been talking about everybody else.
Yeah.
Yeah,
and they deserve acknowledgement for that.
Absolutely.
It is a lot.
Absolutely. So they get their one purple box, and that reminds us to acknowledge them. Okay, so could you say more about the central unit repository you mentioned in your testimony and what it will look like and who will have access to it and how they'll gain access?
Yeah, so we've been working on that, and DHS OIS team has been working on the data system. We have a joint governance with TCP and the ICH around how we create a system that can work for our community. We're trying to reduce the redundant contacts that people make with landlords when they're looking for units. So if from the FRSP program, from various case managers, from the various case management providers, so they're not all calling the same landlords over and over, but when there are units that we have a central database and that's a resource for everybody to be able to tap into. This is a big change for our community, and we're doing it with a lot of intentionality because people have developed relationships with housing providers, and there's a sense of I don't trust how other people are necessarily going to treat those relationships. So with that also needs to come some careful attention on the relationship management piece and making sure that our housing providers have a point of contact around any issues that they're experiencing, and they're getting great customer service from the programs. And so we've been building out both the IT system to support that, the capturing and the tracking of the units, and we've been consulting with our housing partners, our landlord engagement committee around this, as well as with our providers and housing navigators who work across the system. And we'll be in, we expect to be in UAT by the end of the year.
UAT? User
acceptance testing.
That is like wildly not an acronym that I would have known. So I'm glad that I have.
I've had to be part of way too many systems rollouts over the last years. So I've learned some of the information IT systems acronyms during that time.
Stuff you can't ever unlearn from your brain, I guess. You can't delete from your brain. Okay, so DHS has frequently emphasized that provider staffing is a primary obstacle to getting people housed. At what threshold does a provider have to be staffed up to start receiving clients? And is it when they have one PSH case manager, two, when they're at 100% staffed up under their contract? Is it different for each provider?
So I want to just kind of in the premise of the question, we're not trying to point fingers at providers. It's the whole system, including case management providers.
Yeah.
I think that's important to note because it's all of us. It's the people who do the eligibility for the vouchers. It is the case managers. It is the folks who manage those contracts that do the conflict-free assessments. All of us in the community need to scale, including our providers. And that is one area. And so it is, there's a range in terms of the caseloads that providers can carry. And it is based on what they're telling us they're ready for and that they have the staff on board for. So no, they don't have to be at the ceiling of their contract in order to get referrals.
Okay.
But what is shifted, and I think this is important, so I'm talking about referrals, but now we have client choice. So they may be ready to receive, and we heard testimony from one of our providers that we have 7 or 5 or something like that available. And when someone goes through the conflict-free assessment, they're choosing from the providers who have availability,
Mhm.
and it takes them choosing that provider before that assignment is made to that provider.
So if it's someone who hasn't been around as long, for example, they might not have the name recognition, et cetera.
We provide information about the available providers and talk with them, but we're and
there's choice.
And including their expertise, because some providers have historically really served families, for example, and they want to continue to serve families, and they feel like that really is what they bring, and so they may not be as good of a fit, and we help people understand what the experience is. Some have been really incredible around people working with people who've experienced a lot of trauma, and so we really, based on what we know about our providers and they tell us, we have information to help people with that choice. And we're excited. We have a lot of qualified providers. They have to meet a certain criteria in order to be on that list. So there's no bad choices.
All right. I am almost ready to turn directly to DC Housing Authority. However, I just want to make sure we don't need this last question answered for any reason that I'm missing, because I think we kind of covered it. I think we're good. Thank you. All right, so just a few questions for the Housing Authority. Obviously, the Housing Authority has a lot of work to do as an agency in the coming months, and we know it's been a challenge to get the inspections necessary to get people housed completed. With so many people waiting on housing, can we allow providers to do inspections the way we did for a bit during the pandemic?
I'm sorry, can you repeat the question?
Sure. So for a time, and I believe this is no longer the case, we allowed providers such as Pathways to Housing, who are working with clients, to be the ones to perform the inspections. And I'm wondering if that is something that we could allow again to ensure that we have speedy access to inspections and getting more people housed quickly.
So at this time, we do have an inspection team in place to ensure that all units meet housing quality standard qualificational criteria, which is the minimum that HUD requires. And so as it stands now, DC Housing Authority will continue to conduct those HQS inspections until further notice.
So what's the wait time now for an inspection?
So as it stands now, when an inspection is requested through the step 2 process online, that usually takes between 2 to 5 days for an inspection to be scheduled. But also there's a whole process providing that we receive verifications, eligibility, the rent is approved. And so it's not just, that one process per se, but when it passes, when it meets eligibility standard, on average is 2 to 5 days before the inspection is actually scheduled. So there are no delays with inspections.
Okay, so just curious if there is a reason why DCHA insists on doing it in-house when we have providers who have been willing to do it with qualified inspectors and who are available and could just add to deepen the bench.
We are open to that, council member. We are actually open to that, but until that happens, we are comfortable with our process. We obviously want it to be more effective. We want to definitely streamline the process. So I'm not saying that we are opposed to it. I'm just stating what the current process is. So we are open to exploring that.
The 2 to 5 days, is that for virtual or in-person inspections?
So as Jenna stated, we are currently doing most of our inspections. Well, all of our inspections have been virtual. We're looking to complete some inspections in January, but we have found that the pandemic has shown us that we can still get the work done. We have increased the volume of inspections we have been able to complete by doing them virtually, but we know that there is some room for improvement even in that.
Okay, so folks are really eager to get into their housing. A virtual inspection can miss things. And I'm worried that a virtual inspection just doesn't cut it the way that an in-person one does. And yet we really have a time crunch here. And it seemed to me that when providers were able to help, we almost eliminated even like a 2 to 5 day turnaround because they're there already. I mean, they're there looking at the units with the client and can get back quickly or can do it same day. I'm unclear on exactly how that part works. But I would say, you say you're open and I appreciate that. So just let me say very clearly, I strongly urge the Housing Authority to implement a partnership with providers to do in-person inspections as soon as possible, because they're offering to do it. They're already part of the ecosystem here. We're not talking about adding another party into the mix. And I think it will be higher quality and quicker turnaround. And this is one area that we can still improve. So I'm essentially imploring you to do it, and let us know what hurdles you have administratively to do it. This is something that I think before both of your time had been asked of the Housing Authority from the providers. And so it's been pretty consistent, I would say, for at least the past year, that this be something that we adopt permanently.
Okay, and thank you for that.
Absolutely. Ms. Vasco, you mentioned that the inspections, well, all right. What, okay, so now, okay, you had mentioned something about 2 weeks to schedule. Is it 2 weeks? Is it 2 to 5 days?
There's a step that happens before inspections that I think we're all skipping over. And so I think it's important to mention that. So after the landlord packet, the RFTA packet is submitted, someone has to review that packet and make sure that everything is in it, and that it looks okay, that the rent is reasonable. And so that takes a week. So after the packet is submitted, there's a week of processing of this RFTA packet.
Got it.
And then the inspection is scheduled. So when you look at that whole period of time, it's 2 weeks.
Okay, I got it.
But the inspection itself is 3 to 5 days.
Thanks for the clarification. And did not mean to just not note that part of the process. Obviously, part of the discussion today has been, why does it take so long? What are the steps, right? And so I do think with the provider inspections, that gives us an opportunity to sort of streamline a piece of this where other parts we really can't. So thank you for that. And then some things can happen sooner if there is an urgent need, I think you said, Ms. Vasco. And so how do we define that? What creates an urgency around an inspection?
I would say sometimes an emergency move or an emergency inspection because of an issue in a unit are the two things that are most frequent.
Providers have asked for one centralized processing portal that can be accessed by clients, case managers, landlords, and the Housing Authority. Do you think that's possible?
I think the challenge with that is privacy. And so there are laws that prohibit us from sharing information with large groups of people. I think as a next step, we're exploring whether tenants can have access to their own inspection information through our portal, which would create more transparency for people. But it's not the full centralized portal that everyone's asking for. But it would control for the privacy issues that we have identified.
Mm-hmm. That's just for the inspection.
Yes.
Okay. Okay. I think that is all I have for today. If we think of anything else, we will follow up. And I want to thank all of our public witnesses, all of our government witnesses. This will conclude today's public hearing. If you plan on submitting written testimony for the record, please do so by emailing it to humanservices@dccouncil.gov. We are now .gov by close of business on Thursday, November 10th. The time is 1:44 p.m. and this hearing is adjourned. Thank you.